packet. That partnership between the county and the health department is codified in Florida Statute Chapter 154. It does talk about that relationship and the contractual agreements between the state and each county through that core contract. I do go on to sort of highlight, there's a lot of health priorities here in Pinellas County, one of which, unfortunately, and I know Dr. Thogmartin probably touched on this in his presentation, is the opioid epidemic. Unfortunately, those trends are continuing to go in the wrong direction. So we're proud to partner with the county, with a lot of our community partners through the work of our opioid task force, looking at things like the needle exchange, continuing that work, looking at the future, such as the abatement committees that can hopefully leverage and utilize some of those settlement dollars. With the support of the county and the millage, we've been able over the past few years initiate a number of programs, one of which is the school health nurses. We have for now 2 years straight have a nurse in every school, leveraging both the local, state, and federal dollars to that end. And as a result of that program, we've seen great improvement in the metrics. The return to class rate is 86%, better numbers as it pertains to mandatory screening. This current fiscal year, it's a little over $7 million. With the funds going to clinical services and support, school health nurses, as well as dental health, among others. So the upcoming fiscal year, we are not asking for any millage increase, starting with that. The projected millage is about $7.9 million, although it's an increase. We do have some increased costs, most notably the infrastructure funding infrastructure, specifically the St. Pete roof, which is projected to be anywhere for a total of $3 to $4 million. The idea is to save or do it in phases, about $1 million per year over the next few years. The other thing I'll add and to sort of highlight is some requests on fee changes. We got a few as it pertains to tattoo artists. Just to give you a little background on the program, that program was started in 2013, and since that time we've seen the double in terms of the volumes. This is, although there is some state fees, it's not enough to cover costs, and what we're asking for consideration is in line with what other counties are doing. And the other increase that we're also asking is the certified copy of the death certificate from $8, what it is currently, to $9. Again, this is in line with some of the surrounding counties. In fact, it is less than some of the surrounding counties. And again, with some increased costs, the 5% increase you may have heard about with the state employees. There are factors, and as with any healthcare system, we are seeing the workforce challenges, and we're hopeful that things like that 5% increase will also help with that recruitment and retainment efforts. So with that, I'll stop there.
Questions for Dr. Cho? Commissioner Seal.
I just wanted to thank you most sincerely again for everything that you and your staff have done during COVID. Your calmness, your demeanor, just everything that you've done has been outstanding.
Thank you.
So thank you. And also, looking at the slide, I'm very proud of, there's a school nurse in every school. And look at the return to class rate was 86%, and number of services, 751,652. That's amazing.
I appreciate that.
And the sealants as well. So.
Yeah, and again, that's due in part largely to the support from the County Commission.
Thank you.
Commissioner Long.
Thank you, Dr. Cho. You didn't really touch on it, but I'm sure it won't surprise you that we would like to know if you have current numbers on the escalation of COVID in our community?
Currently, our percent positivity is about 14.5%. Over the past few weeks, we're hopefully seeing a plateau, but it's something that we're going to continue to monitor on a near daily basis. The messaging and the hasn't changed, just taking the appropriate precautions, getting vaccinated. So we'll continue to push that along.
So along those lines, several weeks, maybe a couple months ago, you and I had a conversation about taking the second booster shot. Would you recommend that we do that now?
Yes. So with the CDC guidance, I just referred back to that. It does recommend the second booster. The second booster for those that are high risk for developing severe disease, those older than 50, and those with certain conditions such as immunocompromised states. The other thing that I'm monitoring as it pertains to that front is, I believe, Moderna, and I think it was Moderna that's looking at bivalent vaccines as well, that does have that coverage on Omicron, so something that I'm looking long-term.
So maybe when you find the answer to that, you could come back and let us know, because I was listening to a little bit of a documentary a few days ago or whenever it was, and they were talking about how they anticipate that getting a booster shot every year for the COVID and the Omicron is going to be as important as we all get the flu shot every year. And so in thinking that through, is it better to get them separately or at the same time?
The current guide, and again, I don't think we're at that point to recommend anything annually. It's not in the CDC recommendations. In terms of getting it concomitantly with other vaccines, there's no contraindications. You can get the flu and any COVID booster at the same time.
And you get that from your own private practitioner?
Yeah, it's pretty readily, are you talking about both?
Yeah.
Readily available in terms of some of the private practices, the pharmacies, as well as the health department.
Excellent. Thank you very much.
Thank you.
Further questions? It is interesting, the school nurse program is something, this is probably not for you, Dr. Cho, but for us, is that we answered the call several years ago from our school board begging us to fund this because the state wasn't funding it. The budgets were different then than they are now. Now the state is flush with cash beyond their wildest dreams, that maybe it's something that we should communicate with our school board to advocate for full funding for that. That would allow us that funds that we've been committing to it to address other community needs as well. I mean, that it was done in a kind of a, we're desperate, this is important, we filled the gap, but now the state has money that they don't know what to do with, that we could go back and advocate for that. Again, that would let us address some of the other community needs that we talk about all the time. Yes, ma'am. Further questions? Thank you very much for being here this morning. We really appreciate it. Always good to see you. Next up,
All right, Dr. Thogmartin.
Dr. Thogmartin.
Morning.
Right button. When you talk.
Okay, so this is what I'm supposed to press? Okay.
That's it.
Yes, this is, I think, year 22, I guess, here. Most of you guys know me. I hope you have my PowerPoint, at least the printout. It may be helpful to follow along. If not, it's not really necessary. Basically, we're the Office of Synthetic Opioids now, I guess. Our total autopsies district-wide are up 10% from last year, and the year before that, they were up about that same amount, maybe a little bit more. Pinellas autopsies up a little over 9%, and Pasco's autopsies up a little bit over 10. And yes, it's all fentanyl, 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 sometimes with methamphetamine mixed in, and it's just going and going. Obviously, with that, our scenes are up, and autopsies are up for Pinellas significantly, a general positive slope. and a pretty precipitous positive slope in Pasco as well. Now, as far as drug-related deaths, I'll try to give some timeline so you understand. Everybody knows about the pill mill crisis from back in like, I guess, 2008, 09, 10, and then it was crushed. You know, the pill mills were crushed, and then we had a holiday. So we went from, at that time, district-wide, we were running about, say, you know, accident, drug-related deaths, peaked out about 440, 450. Then it went down once the pill mill thing was kind of taken care of by the authorities, and it dipped down into the 200s. So, you know, you're talking about 200 fewer deaths from that accidental drug OD cause. And that lowest point looked like it was 2013, 2014, and then we started climbing as the people that craved, I guess, opiate and opioid-like drugs started finding other sources, and the other sources were provided from international sources, and now we're up in 930 last year. So so pill mill crisis 450, now we're more than double that. And it's looking like this year we're up. We're continuing to go up. So my preliminary values from this year is we're probably going to beat 930.
Excuse me, Commissioner Long has a question.
Dr. Thogmartin, are you seeing in these examples that you're giving, is it mostly our young people? What's the age factor in what you're seeing?
All ages.
All
It probably goes, I mean, I get 60 and 70-year-olds with it. So it's, you know,
Really?
late teens all the way up, all through the, mostly, I'd say from a, you know, basically all demographics, and all ages. Men and women. Everybody likes it. It's like brain candy. They like it, I guess, and they don't realize that it's just super dangerous.
Wow.
I'm looking at page 5 of the presentation, and I assume that's the numbers you're talking about. Is there, I see a dark blue and a light blue on that graph. Is one Pasco Pinellas, or is?
That's correct.
Okay.
That's correct. And then, so we're up, just the opioids alone for Pinellas, just opiates, we're almost at 500. And then, if you look at my operations manager was good enough to make a graph going back to 2001, and that is a 20-year trend for this county. And if you look at it, you'll see, you know, your major types of death, motor vehicle accidents, various suicides, and then homicides. Despite the fact that Pinellas County obviously has grown, those are all staying the same, pretty much. So that's good. But, you know, the red line is starting about 2015 is the accidental drug ODs, and that's the fentanyl, methamphetamine, fentanyl combo. And it's just dwarfing everything else. It's basically those types of cases alone would, in order to maintain accreditation, it's 2.5 physicians I have to have. So I don't know what the solution is. I'm just reporting what's found. And then from the forensic lab point of view, the DNA section, we're doing a lot more DNA, about 19% workload increase. Seized drugs, believe it or not, is about steady. And that's mostly because during COVID, there was less interdiction. So in 2021, the interdiction starts again, and so you end up with about equal. There was just less stuff going on out in the outside world then. And then toxicology obviously is up, and postmortem toxicology, of course, is up. Now, I have to make a nod to my lab director, because she got kind of angry with me last year about saying some award that they got, so I'll explain the award. To give you an idea is, you know, they got the Foresight Maximus Award from ASCLD, which is, you know, it's an award where they figure out how efficient you are with, you know, how well you spend taxpayer money, how well you do with your workload, and you have to have at least 90% efficiency. And there's only 13 labs in the country that received it. They were one of the 13, and they're more than 90%. And they got it last year too, so it's a really big deal. It's like me saying you got the Academy Award at some award. That's great, you know. No, it's like Nobel Peace Prize, I guess. Now, what we're going to do is we'll just try to deal with the workload, the synthetic opioids. The thing is, I'm trying to explain how that affects an office. Is that if you have a drug overdose, basically you end up with an anatomically normal person. And they shouldn't be dead, but they are. So those types of cases are labor intensive. You have to do a complete autopsy because anatomically they're normal. So you have to do everything you can, keep the tissue you need, look at what you need to look at, because what happens if it appears to be a drug OD and it's not? Then you have to have the sufficient information to fall back on to find an alternative cause. So the autopsies are complete, pretty detailed, and then also the toxicology. You have to do a pretty extensive level of toxicology, which is expensive, takes time. And then now what's interesting is there's a new class of drugs called nitazines, and they're opioids, they have the same effect. They're super potent. We can barely see them at all. And we cannot quantitate them. We have to send them out. And every time we suspect a nitazine overdose, which is, it would be a tiny amount in your blood, we have to send it out for a $750 quantitation. So as fast as we move to figure out what's going on, it seems like the illicit drug manufacturers move the goalposts a little bit, make it just that much harder. So we'll just try to keep working with it. I expect that right now, Pasco County, their workload is expanding, their population is expanding. I'm going to start mentioning to them they probably need to think about a satellite office because it's becoming, your building is becoming crowded with cases and people. So I think it may be time for them to start planning a satellite office and to have their own, their population and workload would easily justify it. They and of themselves are larger from a workload standpoint than a lot of independent ME offices. And we'll just continue to look for efficiencies. My budget increase is total is less than 4%, and the contract amount is about 6.9% increase.
You mean the contract with Pasco?
No, my contract with you
okay.
guys is up about 6.9%.
Okay. Well, my question every year is, are they paying their fair share?
Yes, total outside revenue is up 249,000. It's what I estimate. It's an estimate. So if they're, I just increased their fees for various things, and it's a good thing, particularly like transport and things require driving, thank goodness. I have a certain deadline to put that in, thank God I did. Of course, our gas costs are hitting us pretty hard. But your total outside revenue's up about $250,000. If they do have more cases, they pay more. It's just, however much they have, if they solve their drug problem, then they're pay less. If they continue to have more problems, they pay more.
Commissioners, I'm also meeting with the new county administrator in Pasco on July 7th, and so I'll bring this up as a topic in terms of any things that they have in their future. So,
Further questions? As always, thank you very much for being here. Thanks for all you do. We appreciate it.
Thank you.
Thank you for your dedication.
All right, Human Services, Mr. Rose.
Thank you, Mr. Chair. So we have Karen Yatcham coming to the table and Clark Scott. We're going to the model where Abigail here will be presenting first, and then the department will do the second half of the presentation. So, Abigail?
Good morning. Thank you for letting us be here today. I'm a relatively new analyst with Human Services, so I'm very fortunate to have Clark and Ms. Karen here to support me, and I will probably direct a lot of your questions towards them. But we're going to start on page 1 of the document. I will try to update you as we move through different pages. We'll skip over the department purpose and talk about our topics for discussion. So the first one is the design and procurement of the optimal data set and the Behavioral Health Coordinated Access Model, or CAM. These were completed this fiscal year and will be implemented in FY23. The work is continuing with partners to improve contracted service delivery and opportunities to meet the needs of our vulnerable citizens. And this is including the future development of drug court dashboards across all divisions. We're reviewing public defender jail diversion clients and complex case coordination between safety and emergency services and human services. You heard Dr. Thogmartin talk about the opioid epidemic in human services. There are currently efforts to allow the department to work collaboratively with partners to pursue grants and initiatives to implement a range of behavioral health and opioid mitigation efforts and respond to community impacts. And examples of this are they're working closely with safety and emergency services to acquire funding to combat the opioid crisis. This is by creating quick response teams. They're also coordinating with local service providers on a new grant award to establish a complex case reintegration program. And this is designed to provide intensive care management and warm service connections for justice-involved individuals, including substance use treatment, housing support, workplace readiness, and ongoing service navigation. They're also developing a community dashboard to help improve the information available with our community partners related to the opioid task force for data-driven decision-making. And they're also working with community departments on partners on the development and implementation of a local syringe exchange program. That's not county funded, but it's required for the development of local infrastructure to allow operation to help mitigate the spread of infectious disease. We're pursuing the implementation of a Pinellas County Empowerment Team 2.0, which is designed to build on the lessons learned from the original Pinellas County Empowerment Team pilot, while striving to provide intensive care management with recovery-oriented treatment plans to achieve stabilization of clients who demonstrate higher acuity. We're also working with hospital partners to pilot the Pinellas Matters program, which is a program that was designed to improve pathways from hospitals to services and medication-assisted treatment for individuals who have a substance abuse disorder. We're continuing collaborations with Pinellas Integrated Care Alliance, and this alliance includes Central Florida Behavioral Health Network and the Pinellas County Sheriff's Office, as well as the Juvenile Welfare Board and the Florida Department of Health of Pinellas. We've also reinitiated the Juvenile Justice Citizens Academy to help engage citizens in navigating justice resources. And Human Services has underway in our current fiscal year 22 a replacement information system designed to support operations across services to help unify efforts towards data-driven service delivery with ongoing data analytics. And this project is planned to be part of ARPA funding, the American Rescue Plan Act. We'll move into proposed changes to user fees for FY23. In this department, there are none. User fees for consumer protection were reviewed as well, and there are no changes recommended. There are 2 decision points or decision packages this year. The first one is the Behavioral Health Coordinated Access Model implementation. This is a one-time, so non-recurring $1.3 million cost. This would be the second phase implementation of the Behavioral Health Coordinated Access Model under the Plan for Elevating Behavioral Health in Pinellas. And under this phase, KPMG will work with stakeholders to provide direct co-management support for 4 stages of implementation. Those 4 stages are project management and vendor support, performance monitoring, testing, and expansion support. Phase 1 was a $1.1 million contract with KPMG, the same contractor, and it will have an estimated expenditure in FY22 of $790,000, and we're hoping to complete this in FY23. The other decision package is a cost of operations increase for nonprofit organizations. This would be a recurring cost of $313,930 annually. Pinellas County Human Services is requesting this decision package. It's based on 5% of what is currently being spent by nonprofit organizations. The contracts with these nonprofit organizations is through the general fund appropriations. And this includes, in that 5%, only programs and services that have been recently competitively procured. It excludes items that have been recently competitively procured and items that are funded by federal, state, or local grants, or if there are contracts that have been negotiated that have ongoing annual increases. So the total amount that was calculated, this 5% was calculated from of operating costs was $6.3 million. So I'm going to move into the budget summary. We'll start with revenue. So the Human Services Department revenues outside of the general fund support totals of $7.2 million. This is an increase of $1.13 1.1 million. That's 18.1% compared to the FY22 budget. The overall budget increase is largely associated with federal grants within intergovernmental revenues. So we bring federal grants into our general fund expenditures, and that's why you're seeing such a large increase. If you look at the chart, I want to call your attention to the FY23 non-general fund amount for charges for services. It has a little star next to it. I want to point out that this is the Drug Abuse Trust Fund, and it provides financial assistance grants for qualified local drug abuse treatment and education programs.
That's the top of page 3.
I'm sorry, we just moved to the top of page 3. Thank
Right.
you. So I'm going to move on to expenditures now that we've looked at revenues. Expenditures total for human services, $67.9 million. This is an increase of $360,600 or 0.53% compared to the FY22 budget. The overall budget increase is mostly related to a rise in personal services costs, and this is resulting from the increases associated with the career path and ladder initiatives. Pharmacy costs reflect a decrease of $658,730, and this is due to a reduction in encounters and specialty prescriptions related to the pandemic. So we mentioned earlier, there's just less activity going on. These costs are expected to rebound as clients return to practicing normal healthcare activities. Non-contract specialist costs reflect a decrease of $751,810, and this is a reduction also to encounters due to the pandemic. These costs are expected also to rebound as clients return to normal activities. Other contractual services within the Justice Coordination Program reflect an increase of $612,800, a 15.7% increase. And this is largely related to new grants being awarded in FY23 and several grants that were originally awarded in FY22, but their work for those grants has been extended into FY23, which is why you're seeing a budget increase. The Drug Abuse Trust Fund revenues are decreasing by $8,790. It's a 24% decrease. The trust fund expenditures are also decreasing in FY23. And the department previously had been awarding more grants than revenues received in this fund with the intent to lower the fund balance. In FY23, fund expenditures were lowered due to continued declines in revenues. Also want to point out the FTE in FY23. There's an additional FTE in 23, and that is a grant-funded position that was added during FY22. It's an administrative and technical support position in the health center program. And the source of the funding for this additional FTE was the HRSA, American Rescue Plan Act. You can also see the budget summary by program and fund. So if you want a brief description of what types of activities are occurring by program, and then the associated budgets with the funds in those programs as well. And if you don't have any questions related to budget, I will hand it off to Ms. Karen and Clark, starting at the bottom of page 6 to cover the FY22 accomplishments, the performance measures in human services, as well as their work plan items.
Hi, good morning. Karen Yatchum, Human Services Director, and with me I have Clark Scott, our Business Services Division Director. As Abigail mentioned, I'm going to walk you through some high-level accomplishments, performance measures, and then touch on our work plan that we're going to be accomplishing over the next year. Two of the big projects that we've been working on over the past 2 years, again, are the optimal data set and the coordinated access model. And so this past year, we worked with KPMG to develop the 29 key performance metrics that will be reflecting access to care, capacity of care, and then quality of care. And those are really going to start off with behavioral health case management. We're going to move on to other service lines, and really the goal is to have a very robust dashboard that really reflects the health of our system within the behavioral health space. We are doing that work in concert with our members of PICA, so again, Central Florida, Juvenile Welfare Board, the Sheriff's Office, and the Department of Health. Our goal is to have similar or same contract language across all funders, collecting same or similar data into one dashboard that will have elements that are public-facing, but really will be presented to the decision makers so that we can look at funding strategies, shifts in funding, gaps in services, and possibly new grants that need to be acquired. The coordinated access model was also designed this past year, so we met with many community stakeholders, systems that intersect with the behavioral health space. We interviewed national behavioral health experts to design this model. The model was competitively procured this year, and we are currently working with the vendor, which is Unite Us and USF College of Behavioral Health Sciences, to finalize the scope of work. Once the scope of work is finalized, we will start the implementation process, and our goal is to go live with that process in spring of 2023. And just a reminder, really what our intent is for this coordinated access model is not information and referral. So we really are going to be looking at having trained clinicians on the other end of that line, providing triage to callers, assessment, and then scheduling. And really what we're looking to do is share that information with providers, and our goal is really to reduce the number of times our residents need to tell their story, go through their history, and really have a mutual sharing of information. We have also charged our vendor with creating additional aspects of care for our community. So working with local nonprofit, local private providers, telehealth providers, national telehealth providers, because again, the CAM is really going to streamline access, but it's not going to create additional access. So Unite Us has a long history of working in Florida and with other states on developing those relationships. And so that really is our goal, because we want to make sure that our residents have choice and that they can also have the soonest appointment available, whether that's with a larger provider or a smaller provider that may offer telehealth services or down the street from their home. Additionally, this year, we have competitively procured our new 45-foot mobile medical van for the Healthcare for the Homeless program. Our current van is 11 years old, and we are absolutely seeing wear and tear, so it's going on and offline throughout the past 2 years. But the goal of this van is we're really looking at how can we increase technology, how can we increase the clinical services that are being provided. So historically, the van offered 2 primary health spaces, and where we're moving is how do we make that space more adaptable. So we're going to have dental on the van moving forward. We're also going to have primary space in the van, and we're also going to have telehealth, because we're looking for this mobile unit to really deliver all aspects of care. So the telehealth component will have access to mental health and substance use treatment with our contracted providers through that program.
How many days a week is the unit running?
When everything is working, 5.
5 days?
Yes.
And how many different locations through the county? Is it 5 different locations spread out through the county, or is it?
It's multiple. So there are some locations due to volume where we're there the whole day, and then some locations where we're there just half day. And this past year, we piloted a North County location. So we're looking at Tarpon Springs, because really our van stopped at Clearwater. And so we're trying to really make sure that we're working with the northern partners as well to pilot that access.
Okay, thank you.
I'm sorry, I didn't. Did you? Oh, okay, okay.
That wasn't for you, that was
Okay.
sidebar.
Okay. In addition to increasing the tech on the van, we're also rebranding the van. We're wrapping it. Currently the van right now is a white van. It says MMU. We're working with our communications department to wrap the van in a beautiful branded space. That our hope is that it really increases that environment, the welcoming. We're trying to bring people back into medical care, and that really is our goal. So the van is procured. But as you know, with kind of supply issues, we're looking to have the van sometime in 2023. As you know, this past year, we also submitted the age-friendly 5-year report. AARP will be at the next Board of County Commissioners meeting to present an award on that accomplishment. And then in the coming 2 years, we'll be developing the brand-new age-friendly report and plan and how we can develop that to continue all of the services we're doing for all ages in our community. Lastly, I'm going to touch a little bit on the quick response teams that we have developed this past year. So that really was a team effort. So we worked very closely with Safety and Emergency Services. As you can imagine, we're serving very similar populations. We were awarded a grant that really gave us the space to create this quick response team. And really what this does is it gives EMS another tool in their toolbox to navigate someone to treatment. And so what we were continually hearing is that EMS is responding. They're providing Narcan. They're reviving individuals. They're bringing them to the emergency rooms, and that's it. And so what we have created is we've trained the EMS staff to talk about engaging in treatment. And when someone is revived and they're willing to engage in treatment, they sign a form and it electronically goes directly to our contracted provider, PAR. So it's not person dependent, no one's faxing a referral, no one's emailing a referral. It's an electronic ping that goes to Operation PAR 24/7, 365, and then they have a certified peer recovery specialist start that engagement within 72 hours. So they are outreaching to that individual. We're not waiting for them to access care. They don't have to make the phone call on their own. Someone with lived experiences is making that call to them. This process went live in October of 2021, and since that time, we've had 175 individuals agree to treatment. We have made over 1,000 engagements to those individuals, 375 case management contacts, and 10% of them have engaged in treatment. So they're engaged in formal opioid treatment. And really what is unique about this process is we've flipped it. So they're not giving a pamphlet to call on their own. That peer is able to have that conversation from the peer perspective, share their story, share their recovery, talk about what it's like, and really they've been there, so they know what it feels like to be in that space. So we're really proud of the 10%. We're getting a lot of praise in the community about this model. We've had a lot of teaming where Operation PAR staff are doing ride-alongs with EMS. So there's just, I think the possibilities are endless, and I think anytime that we can proactively engage individuals, that's really the space that we need to be in. All right, so I'm going to move forward to performance measures, and I believe that is on the top of page 7. So as you heard from Dr. Thogmartin, the Pinellas and Pasco count is approaching 930. Pinellas specifically is 618. And again, we are moving in the wrong direction despite all of our efforts. This is not a Pinellas County specific problem. We're seeing this in the entire state of Florida, nationwide. Most recent data shows that in 2020, the national deaths were over 90,000, and we're seeing a 6-fold increase in deaths related to fentanyl or fentanyl analogs. And really what that means from a treatment perspective is we have to look at how is treatment being delivered? You know, does treatment need to change? Does the approach need to change? And what we are hearing is that the number of Narcan administrations that need to occur when someone is using those very, very strong substances is sometimes 3 and 4 times to have them be revived. What I can tell you is that Human Services remains very committed to researching national best practices, working with partners, and really doing everything possible that we can to continue these innovative practices to combat this issue. Additionally, Human Services measures suicide
Commissioner Gerard has a question.
Just wanted to know if we have local clinics that administer Suboxone
We
for
do.
recovery.
We
I
do.
mean, I know that one was turned down in Largo not too long ago, but.
Okay, so I know that our contracted providers do both methadone, Suboxone, and Vivitrol, and that's also part of the Pinellas County Health Program as well. Human Services also measures suicide data, and so the most recent data that we have indicates that 192 lives were lost in 2021, and year-to-date, we have had 66 individuals complete suicide. And while we're not seeing huge increases in this, I really think a lot of that has to do with the collective work that's being done in our community. I really think we're going to start seeing additional progress with the rollout of the National 988 Suicide Lifeline number, our coordinated access model, and then the work that we're continually doing with Zero Suicide Partners of Pinellas. So really going out, talking to different groups, talking about care, stigma busting. That's really the space that we need to be in to really work with the suicide.
So you said 192 last year.
Yes.
And year-to-date, 66?
66. And the last measure I'm going to touch on today is our homeless measure. And so the way that we're currently measuring this is percent of clients who return to homelessness within 24 months. The COC recently kind of re-looked at all of the different measures and how this is currently being measured. This one is that the benchmark really is no more than 30% will return. And so as you can see, Pinellas County is consistently under that benchmark, and year-to-date, we're looking in that direction as well. What I can say in general regarding human services measures, this is kind of an ever-evolving area. So we have some very high-level measures right now that we're looking at, kind of health of the county, health of our residents. But with the continued work that we're doing with KPMG, the continued work that we're doing with the homeless system, I think we're going to start infusing a little bit more measures into our kind of review so that it's more comprehensive of not only the health of our residents, but also showcasing some of the work that we do internally, but also a lot of the programs that we fund through the department. And now I'm just going to briefly touch on the work plan over the next year, and this is on the middle of page 7. So as mentioned previously, we are really going to be working on the ODS as well as the CAM. Those are huge projects that we're going to be working on over the next year. We have started with one provider so far with the ODS, so working through every single data point, working through the dashboarding, and I will say it's going extremely well. So I really feel promising moving forward with that ODS space. I also will say for the CAM, you know, every meeting that we have with the vendors, it's so amazing on kind of what the technology is, what the partnership looks like. Everything is like a yes so far. So I just want to make sure that you're feeling the assurance that we feel each and every time that we meet with that vendor. As mentioned, we're going to be working to roll out the sterile syringe exchange, and that has a go live date of August of this year, so August of 2022. We will be finalizing the new agreement with Pasco County related to the medical examiner's office utilization. So we'll take that into consideration, what Dr. Thogmartin said, but our current agreement expires this year. So we'll probably be working on what the next phase of that looks like while that facility discussion is being had as well. With the utilization of HRSA ARPA funding, we're going to be expanding Bayside Clinic by 2,600 square feet. So we're adding dental space, we're adding additional behavioral health space, telehealth space, as well as negative pressure isolation rooms in the event that any of our clients need that type of care related to any type of pandemic. With those funds, we're also going to be implementing street medicine. So we're going to be taking a mobile team out and delivering care on the streets to those who are unsheltered. So the goal of that is to provide wound care, primary care, dental care, access to behavioral health care, but really to bring them back into the program. So bring them to the medical home, enroll them in the program, build rapport so that they're not relying on the emergency rooms and hospitals for their care. And so that's a pilot that we're starting with this project. This is a well-known kind of national best practice. And what's interesting is that most communities start with street medicine, then they build the clinic, then they get the mobile medical van. We're kind of reversed. So we have the clinic, we have a van, and there are still individuals that we are not reaching. And so this really is our attempt to reach those individuals who really need that chronic care. Additionally, as mentioned, we're going to be using county ARPA funding to increase the technology across all systems that we use within human services. And of note, I think which we're very excited about, we manage over 220 contracts plus grants, and we do that without a contracts management software. So we do that via spreadsheets and manually. So we're really excited for kind of what this tech is going to bring to our department and what efficiencies we'll be able to glean through that process.
Don't undervalue a good Excel spreadsheet.
I'm sure it'll be a backup, but yes, no, I mean, just, yes. So we're very excited about that process. We are continuing to partner with the Foundation for Healthy St. Pete. As you know, they are looking to modernize the information and referral process. So Human Services will be heavily involved in that modernization, working on various work groups to really make sure that that information and referral process can be modern and meet the needs of our residents. And lastly, we are continuing to work on opioid abatement. So we will be participating in the rollout of opioid settlement. We really are like the lead in that. So we will have the opioid abatement board in partnership with the City of Clearwater, Pinellas Park, and St. Petersburg. But once those funding decisions are made to the board, really the heavy work then falls on Human Services. So we will be doing all of the contracting, procurement, program implementation, as well as reporting back up on the various funding that we will be receiving.
We also would like to see the other cities that were not part of that join in and put those funds into a centralized pot to where they can be used regionally. Because individually, they really can't do much.
Do we have a timetable on, I've kind of lost track of where that is in the process.
So I believe we're supposed to be receiving one settlement fairly soon. And my understanding is that's the one that is a lump sum settlement, and then the rest could be spread across 18-plus years.
And then the part for the other municipalities, that's dependent upon, because they've joined in with the AG, and so the timeline on that's kind of unclear.
Yeah, we're in 2022, we're still spending money from the 2010 BP settlement, so these things take a while. Commissioner Flowers.
Thank you so much for updating us on all of that information, because that's all really good. Just wanted to share, the Black Nurses Association in St. Petersburg does a lot of volunteer work. So when you start your mobile units, plus there's some nurses that are looking for, they have to do so many hours in order to keep their license current and active. But they're always looking to partner, and they have partnered with a lot of different events, the dental clinics that come in, the back-to-school clinics for the vision and all of that. So that may be a resource when you start your mobile unit for going out to the homeless. I'll share with you the person's name who's the new president of that organization. She's retired, a retired RN from the VA. So now she dedicates her time to just what she can do to help the health of the community. So that'll be really, really good. Plus, it may be familiar faces that'll help people feel at ease about receiving the services. Thank you also for the positive feedback on the coordinated component for entities to come together to provide that critical service, so that there's that warm handoff for the client, the potential client, versus just, what we've seen before, giving them a phone number, whatever, and expecting that they're going to follow up and call, which they may or may not do that. So having said that, we've heard, not just from our team, but from all over, that there's just this shortage of staff, even licensed clinical social workers, et cetera. So how do you think you may be able to garner enough persons to work within this network, so that when a client calls, they are, like you said, getting that person who can then triage them and, work with them through whatever their crisis is?
So really, that's one of the things we'll be charging Unite Us. But I think what we're seeing is there are a lot of clinicians, even masters prepared, who are being hired by possibly for-profit. They're going into private practice. They're going to telehealth because they really just want to work from home and not have to commute. So our hope is that because of the ease, because of the funnel, this is kind of a business model where if you sign up to be part of the CAM, you're entered into this pool where you can have clients referred to you. So I really think that it's going to be attractive enough to where we could attract multiple different entities who will want to work with the service. And especially private practice, or possibly, boutique providers, because I think we're going to get a wide range of calls. It's going to be those that are insured, uninsured, and our goal is to really have a robust network to know exactly where to go to lessen the confusion for the client, because that is a lift. Even when you have to access any type of care, you're calling your insurance, you're finding the provider. All of that work's really going to be done on behalf of our resident and with them.
Okay, great. Thank you, Mr. Chair.
Thank you. Commissioner Seal.
Yes, thank you very much, Karen, to you and your staff, and it's good to see you too, Clark. The AARP livability score, is it 50 out of 100, or?
I believe it's
trying to-
50 out of 75. I think that's the highest, but I can double check on that.
And where are we lacking?
I can double check on that as well.
Okay.
Sorry about that.
Oh, that's okay. And then the Bayside Clinic, is that, if I remember the stats, I'm still going to conclude that we're basically the clinic for the safe harbor? Or are they serving others?
We are absolutely serving others. And part of what we are actually doing with our county staff, who really do most of the enrollment, is we're getting back out into the community. So years ago, we had all of those staff outposted with partners and at shelters. With the change in staffing, we've lost a lot of that knowledge in our community. So community case managers who knew about the Blue Card, knew how to enroll, knew all of the services that were provided, because of the resignations, that knowledge has left. And so we are going to be outposting a lot of our staff. We will be outposting at Safe Harbor. We just met with them last week on that plan. Some of the data that we're seeing, it was a small sample, but they're not part of our health program. And they are higher utilizers of multiple services. And so we really need to take a look at that and find out what we can do to enroll and provide that wraparound care so that they're not utilizing other services in our community, such as EMS.
Okay. And the integrated service, how many people are enrolled in that at this point?
For behavioral health care,
No, for the PICA, I think it is. What I always call it, sorry, the high utilizer program.
for PSET.
Yes.
PSET, okay, sorry. So we just procured that. So we're just starting that now, PSET 2.0. So we haven't started off with accepting new clients yet.
So are we still around 26 clients that we're
So we're,
helping and monitoring and?
so we're not serving anyone currently.
None?
The previous program sunsetted, and then we went through procurement, and we're going to be starting PSET 2.0 this year.
Okay. So did we follow these former clients to see how they're doing at this point?
So we haven't followed up with them since closure. I know many of them were connected to multiple services within that provider organization. They may have been referred to FACT team or other programs within that service.
I just wanted to make sure that with that investment, that it was successful and that it had some kind of long-term impact. Because again, we were trying to keep the jail population from the high utilization, so,
I can follow up on that.
okay.
Yeah, I think that would be really important information for us to have.
Yes.
That was a significant investment that was
It
made.
was. It was about $1 million, so, and it was a pilot, so I just want to make sure that it's worked successfully. And then I hope people have been asking me, well, what do you want to kind of wrap up before you leave? And one of the things I'd really like to wrap up is just, and I talked to Barry about it, is to make sure 211, that we move this along and the foundation that this moves along and gets modernized. So,
Yeah, and Karen, Lourdes, myself, we did meet with the Center for Healthy St. Pete to discuss that. It certainly hasn't moved at the speed we would like, but it sounds like we're at least on the right path. There's going to be a lot of engagement going forward and making sure that they're part of that, obviously, but very aware, but we agree. It hasn't moved along as quickly. It really needed to go separate from the CAM. We didn't want, it to bog down the CAM because it's got its own politics and players and people in that. So I think it'll align nicely, but it's got to get going. And we know there's been a very long delay getting it through the procurement process and engagement process at the center. So,
thank you very much.
Thank you.
Commissioner Eggers.
Yeah, thank you, Mr. Chair. Karen, excuse me, great report today. Your team is involved in so many amazing things for our Pinellas County residents. Really just continue to be impressed. Excuse me. The work that you're going to be doing with the CAM program coming up, I'm really glad to get that report that said that you're working closely with our providers. Obviously, you're going to need everybody, all hands on deck. So it's nice to hear that relationship continues to do well as you go through this process towards implementation. I was going to ask about the high utilizers, so thank you, Commissioner Seal, for bringing that up. And then if you could just briefly, and if it's too cumbersome, maybe send the information, but you talked about the 175 individuals who agreed to treatment once they were revived through Narcan, and you had some amazing statistics after that. If you, instead of going through them again, maybe everybody else caught all of that. I didn't catch all of it, and I'd really like to see that information.
Sure, no problem. I can send that to you.
Thank you very much. Appreciate it. Keep up the great work.
Thank you.
Further questions? I just want to touch a little bit on the consumer protection part of your organization. I mean, it ebbs and flows as far as where we focus on things, and if there's any trends or highlights that you want to share about the towing ordinance. I mean, do we actually have any restaurants, do we have any, not the towing part of it, but the restaurants towing overnight that serve alcohol? We put that ordinance in 5 or 6 years ago. The requirement for human trafficking information to be posted at adult use establishments, those kind of things. Any trends, any information worth sharing with us this morning?
So I can tell you for the towing, I know the team just recently went through a review of that information, so I can certainly share that, send it to all of you just for an update. Human trafficking, I am updated every single month from Doug. He participates in the Regional Human Trafficking Task Force, which is extremely, extremely busy. He has staff out all the time, making sure that they are adhering to the signage and that they are required to have. I think what's really exciting this past year is to see where the Regional Task Force is taking us and how consumer protection is contributing to that overall goal. So they've participated in a lot of media campaigns, backpack programs. Consumer kind of touches all of these little spaces within our community. I know just recently with the rental scams, they've really been focusing on that proactive approach. So they are looking at every single new posting for rent in our community, and then they are looking at if it's a recent also posting for sale. And so when they find that it's a for sale home that's also being posted for rent, they are immediately contacting the local jurisdiction that oversees where the house is located to catch that person who's trying to scam our residents. So I don't know if that answers. I can definitely send you information on towing, but they are extremely busy and they are a wonderful group to work with.
No, and that's critical. It's just we put some of these things, you know, an issue will flare up, we'll pass an ordinance or a thing, and then it kind of goes away, and we never hear about, which is probably a good thing, but I don't want us to forget those things either. And I'll send you, I got sent this morning some photos of someone who had a car accident. The car was totaled, but they went to the tow lot to get some things out of the car. And all over the window are cash only, cash only, cash only signs, which I know part of our ordinance is that they had to take credit cards. So I want to make sure that we're following up on that. But and then the high prescriber pain management clinics, anything in that area worth? Nope.
Not prepared today for
Okay,
that.
that's fine.
I can definitely send an update. And I think that kind of goes back to my discussion about performance measures. We aren't capturing in some of the high level reporting on what we're providing to the community, where we're really focusing on those health measures. And I think there's a missed opportunity to look at disability advocacy, veteran services, to really make sure that those performance measures are out in the public.
Absolutely. Again, in Veteran Service Office, when I first came on here, that was going through a major restructure, and we focused a lot on it for a while, and the consumer protection. So yeah, I know Doug and his team are out working hard, and I want to make sure that we can go out and take credit for all their good work.
Absolutely.
Commissioner Long.
So Karen, thank you for all of that comprehensive and unbelievable amount of work that you've done this last year. I remember my very, very first strategic planning meeting that I attended when I first came on the county commission, and the administrator after said to me, well, now, what do you think? And I said, well, we provide services for almost everybody, but I didn't hear you say anything about what we do for our aging population. And so he thought that was a pretty good point. And from then till now, I know that periodically we worked on that kind of an initiative and even became a purple county not too many years ago. But I did see in one of your things that it talked about was something for the elderly, but there wasn't a lot of detail there. And I was just curious if you had any specific types of things that you could share with us that's going on in that particular community.
So yes, I can tell you that we are heavily involved in a lot of the senior and aging committees across the county. One of the things that I think we're most impressed with is we have had one of our staff trained in the Dementia Cure Initiative. And so she goes out along with the other trainers in the community to really raise awareness of dementia, dementia-friendly. I know that that group is working with restaurants to kind of help prepare the wait staff on how to assist caregivers who are dining with someone who may have dementia. So there is a lot of work being done in that space. There's a lot of partnerships with the Area Agency on Aging. And I think we have opportunity with our next age-friendly plan to really kind of crystallize more of that work. A lot of work is in that space, and I know with COVID, a lot of those committees stopped meeting just because that was some more of the higher risk population, and they've just started to meet. So there's senior groups on mental health, there's seniors groups on LGBTQI, and we have staff that are engaged in all of those efforts.
Well, I'm so happy to hear that, and I look forward to what you dream of next.
Thank you.
Thank you.
All right, thank you very much. Ms. Lloyd, I'm disappointed, only 25 slides on this one. All right, Mr. Rose, what do we have next?
We have the Office of Human Rights, and Jeffrey Lorick will be coming up. And while he is coming to the table, I'm going to, with your indulgence, take a brief moment of personal privilege. Frederica Collins is back today. You saw her yesterday presenting on the administrator's budget. Today is her 8-year anniversary with Pinellas County and OMB, so that's the first.
Congratulations.
Yes.
Thank you very much.
And secondly, she's finishing up a multi-month training with the Drucker Institute out in California. She's been remote. She's not flying out there every week, okay? But she's finishing that up, and the Drucker Institute was so impressed with her that they've invited her back next month on their nickel for a stakeholder gathering of public sector folks. So just thank you for giving me a minute to bring that up, but we're going to go back to that model now.
No, absolutely. We want to brag about our talent. We appreciate it.
Good, thank you. So human rights, and Frederica's going to start, and Jeffrey's going to take it home after that.
Thank you, Chris, for that introduction. And good morning, commissioners. Today I'll be working with Jeffrey here to talk through the Office of Human Rights budget. So I'm going to bypass the department purpose, as you may be familiar already with what they do, but I'm going to jump into it. So in the budget summary chart, you will see that the department anticipates approximately $254,000 in revenue for FY23. This is a decrease of $16,600 or 6.1% in comparison to the FY22 budget, and is a reduction in case referrals. This is due to a reduction in case referrals and online complaints from the department's federal partners. So two of the federal partners that OHR works with is HUD and also EEOC. Both pay on a per case basis for investigations, including intake, full investigation, and also cases that are resolved through mediation. With the decline in referrals, the investigators have an overall lower workload of cases, allowing them to invest more time to successfully provide a resolution and to also support additional cases from some of our partnering counties, our peer counties. This also allows staff to work on the Americans with Disabilities Act transitional plan for the county. So I'm just going to transition over to the expenditures. In the chart, you'll notice that the expenditures for FY23 reflect an increase of $17,350 or 1.4% over the FY22 budget. The increase is mostly due to a rise in regular salaries and wages and countywide increases in health benefit costs that were offset by a net decrease in wages when vacant positions were filled. The department has not increased the number of positions. They've maintained flat at 10 FTE over a decade now. Operating reflects a nominal increase due to compliance with new requirements by HUD. They essentially have to mail out all correspondence via certified mail, which has increased some of their standard operating costs. The budget supports the ability to promote human rights programs and services through educational outreach, which includes printing brochures, attending events, and a large portion of the operating budget includes third-party legal and mediation services for housing cases, employment violations, and also wage theft. So that concludes my portion of the discussion. I'm going to turn it over to Jeffrey to highlight the FY22 accomplishments and performance measures for the department. If you can just follow along at the bottom of page 2.
Thank you, Frederica, and good morning, commissioners. You did a fine job. I know you've been working really hard in getting that together, and we certainly appreciate that. I'm going to talk a little bit about our accomplishments in this last year. As you know, we provide discrimination investigations for public accommodation, housing, and employment discrimination. We also oversee the county's waste theft ordinance program. The office has contracts with EEOC and HUD, and with those contracts, we are obligated to complete so many investigations. And we are on track to meet those contractual obligations. With EEOC, we have a 40-case contract, and we've already closed 25 cases as it relates to employment. HUD, and we're ending their payment period here at the end of this month, June, and we're meeting that contract as well, where we've closed 62 housing cases. We anticipate having a few more before the deadline of July 3rd. The office has also collaborated with the County Administrator's Office to provide some assistance in developing resources and materials for tenants' rights. We think it's been a valuable program to help get that started. We participated in a panel discussion to disseminate information to the community about tenants' rights, and we actually received a complaint related to that particular outreach, so that's a good thing. The office has successfully engaged in a brochure campaign where we went out to all of the underserved communities and agencies that we think could utilize our service and provided information as the services that our office provides. We continue to provide all internal investigations as they relate to the anti-harassment policy to the county. So far, by this May, we had trained over 700 county employees. We expect to be at 1,000 by the end of July. So our team has been quite busy going out and providing those trainings. Our office has successfully completed and submitted 2 federal reports that need to be done every 2 years. And it is the Equal Employment Opportunity Program Underutilization Report that asks for data for race, ethnicity, and gender. And that grant is important because it helps the county be eligible to apply for grants and funding. The other report that we completed was the EEO4 report, which is also a federally mandated report that's due every 2 years, and it takes workforce data as it relates to race, ethnicity, gender, and salary bands. And again, it's to help the county procure grant monies. We continue to staff the county's waste theft program over the last 7 years and continue to recover income back into the pockets of everyday working men and women in our community. That is a very robust program. And over the 7 years that we've run that program, we've recovered over $300,000 back into the pockets of everyday citizens who have not been paid properly for their work. So any questions that you might have?
Can you say the number again on the wage theft restitution?
Over $300,000 in 7 years. And some of those go before administrative hearing, magistrative hearing. Some of it is through mediation. Our wage theft staff person will mediate between the parties, come up with a sum and agreement, and then we get that money, those monies recovered and sent out to the parties.
And do we still share, I forget what our relationship is with City of St. Petersburg and other municipalities, how we share staff and enforcement?
No. In fact, just I think last year, we adopted, what did we adopt and they closed? Well, anyway, the waste theft was in St. Pete. Since we were doing it, they thought it was a duplication of service, and we accepted it here in Pinellas. We did have, when the Office of Human Rights closed in St. Petersburg, half their staff came over here. And we used to have an office in St. Petersburg. We don't anymore, where we would send staff over 1 day, 2 days a week.
All right, so by sharing, we're doing it all.
We are doing it all. Yes, sir.
Clarence Scott was over that office there in St. Pete, and it was a lot of conversation about, closing that off. I'm sorry. Clarence Scott was over that office in St. Pete, and there was a lot of conversation about closing the one in St. Pete because then persons would have to travel up to actually file, but for cost effectiveness, that's what they decided to do. I will say that's one thing I didn't know. I knew Darden Rice spearheaded the charge with the wage theft ordinance in St. Pete, but I didn't realize that they had decided, since we're doing it, to no longer, that's news to me, which I'm fine with it, but.
I had thought it was some sort of a partnership,
yeah.
but now I understand what that means.
The partnership is you take it. Have a nice day.
Yes.
I do have a question.
Yes, ma'am.
Thank you so much for your report and all that you do. It means the world to people who have issues and need to find somewhere to go to get them some help. And some of your housing concerns or complaints that have been registered with you, do you see a trend in specific complaints?
Well, first and foremost, always, is disability complaints as it relates to service animals.
Okay.
That's first. What we see coming in our office now has a lot to do with an effort that you all are undertaking now, which is lawful source of income, which we don't have jurisdiction over.
Right.
So we're getting a lot of complaints as it relates to evictions. And so we've been sharing it with our county partners, those emails.
So for the issues and concerns with service animals, I know that if it's a service animal, they're supposed to have, the owner of the service animal, they're supposed to have the appropriate documentation that is a service animal, and then there's a little vest or, well, I know for dogs, it's like a little harness and a little vest that identifies that that's a service animal, because some people were just taking their animals, and then they would say it was a service animal, so they could just have the pet with them. So is that the case, or is that different?
I'm glad you asked that so we can provide some clarification.
Thank you.
There is no requirement under law that a service animal wear a vest or harness or even be on a leash. The only requirement is that it's for a person with a disability, and the animal is trained to assist them in that disability. And so there's no clearinghouse to certify a service animal. Anybody can get a certification on the internet for $25, $50. And so that's why those requirements don't exist. And it's like, say, persons who don't have the ability to control their hands, as long as they can control the animal by voice commands or hand commands. So that's why no leash or vest is required.
So it will be up to, okay, so let me back up to, is there a requirement that the owner has medical documentation or something that states that they have a service animal because of whatever their concern is?
Yeah, the only place that would be required said they were applying for housing or employment.
Okay.
But in places of public accommodation, they don't have to produce that kind of documentation. The place, a public accommodation place can ask two questions. Are you a person with a disability, and is the dog trained to assist you with your disability? And the answer is yes to those two questions. You have to permit the animal.
Okay, so and I'm sorry for constantly going on, because.
That's okay.
So
Well, a lot of education needs to be done in this area, which is why we deal with it a lot.
Okay, so I'll give you a real world example. When I served as a school board member, I had one of my teachers say that they had a service animal for an accommodation. He was he was nice, but he was huge, like a little mini horse. And there were several teachers and students who were a little afraid because it was a big dog. It was big. I mean, well manicured, beautiful, but it was big. And so the request was you provide us with something that says that you have this service animal because of a medical condition and or need. So is that, I'm using that as an example because that person could not, and then, then it becomes looking out for the health and welfare of the employee versus looking out for the safety of others, because some people are truly, fearful. So is that something where an organization would have to create a policy that would not take away that person's rights for their disability to have that, but also ensure that the need for the animal is truly the need for the animal?
Yeah. When in a place of employment, and a person has a service animal, or in housing, they want permission to bring in a service animal, they have to provide a doctor's note
Okay.
from a third reliable party. It could be a Veterans Administration, it could be a counselor of some sort. But in that note, it has to create a nexus for the animal.
Okay.
And as long as the note creates that nexus from a reliable third party, then that accommodation can be made. I also want to comment a little bit on the fears have to be articulated on facts and not stereotypes.
Right.
And oftentimes, size of animals or breed of animal will cause people to push back. But service animals are not pets. They're assistive devices. And that's why they must be permitted to go wherever the person with a disability goes, because they are an assistive device.
Yeah, I know Mayor Kreisman, a lady named Kim Black, some others, they actually help raise up certain dogs to become service animals. So, I think it's a wonderful program. I was just trying to get clarification on the utilization of those. And then, because when you get calls saying these people are bringing their dogs in the store and it's not a service animal, but they're trying to say it's a service animal. So just,
Yeah, stores are a little different because they're a public accommodation. But if you have any questions, you can always reach out to us in our office and we'll provide clarification for you.
Okay, and then my final question is, so if a person does have that requirement or need, is there something that helps with the renter when it comes to the fee for an animal? Some places, charge an additional whatever dollar amount they charge, for pets or what have you. And so is there something that would assist that renter, because that extra 200, or I don't know what the amount would be, but that may be a little difficult for them to come up with, especially if they're disabled and are receiving Social Security disability.
If they're a qualified person with a disability, they have a note that creates the nexus for the need for the service animal. All pet rules, fees do not apply
Okay.
to the service animal, again, because it's not a pet.
Okay.
It's an assisted device. Yeah,
you
no, I know,
educated
I'm
me.
just helping clarify.
Thank
They're an
you.
assisted
So now I
device.
can return an email.
Yeah, absolutely.
Thank you. And thank you so much for all you do. I appreciate it.
Oh, you're welcome.
Further questions? Carry on. Was that it? All right, I don't want to cut you off. Thank you all very much for being here. We appreciate it.
Thank you.
Mr. Rose.
So with your permission, we're going to go a little out of order next. Safety and Emergency Services will be up next. We'll come back to the tax collector later on this morning. So we're going to jump one ahead. We have Jim Fogarty and Jason Miller with Safety and Emergency Services.
Can we, we're going to take a 5-minute recess.
Yes, sir. Thank you.
on item number 6, Safety and Emergency Services. Mr. Rhodes, kick us off.
So Veronica Edel of my office is going to present first, and Jim Fogarty will do the second half of the presentation. So Veronica?
Yeah. Good morning, Commissioners. Yeah, we're still morning. Thank you for the opportunity again to come and present the Safety and Emergency Services budget for information for FY23. I'm not going to read through the purpose statement. You all have that, so we don't need to go over it. Going right into the topics for discussion. You all know, obviously, you know about the Pinellas Regional Information Management Enterprise, PRIME, which you approved the interlocal agreement for that on June 7th of this year. So that is one of the main things going on with the Safety Emergency Services right now. So PRIME is going to manage the system for EMS and law enforcement countywide. The allocation of costs among the partners is proposed, not settled yet, but proposed to be based on the number of licensed users with the sheriff's office and then the city's paying for the law enforcement portion. The Safety Emergency Services portion is the Regional 911, and that's projected to be at about $877,000 next year. The ongoing legislative funding issue, this has been an issue for several years, not the first time anyone has heard it. We continue to try to seek an increase in the 911 fees from the state, and that has been a point to where we are down to actually just under $5 million a year from where we were like 5 or 6 years ago. And so the result of that is because more than $9 million of the cost would be eligible for using of that fee from the state, but without that, our general fund is having to transfer money to pay for the 911 fee eligible expenses. So that's very important to us to keep working on that.
And that's really just got to be a fact issue, because
Yeah.
without them really taking that up and getting some change in that legislation, or making other things eligible in cost would also help us to offset that. But we got to really make a push. They've been unable to increase that.
So it's a stagnation of the dollar amount of the fee level over years. So we're having to subsidize that with general fund because the fee collection is not meeting the cost. Am I understanding that?
Yeah, I mean, the history is on it is interesting, and we can get more of that for you, but going back further, it was when people started letting go of their landlines with cell phones, that's when the fee started shifting. That was 10 years ago. That was when I first came into the county. And then from there, one of the issues was we didn't have a point of sale able to pick up the fee from disposable phones. So when they finally came up with a way to pick up that fee on the sale of the disposable phones, they reduced the fee from 50 cents a month to 40 cents a month because the state was feeling like they were balancing that out. But it did not help recover at all. So I don't,
And just for context, this is a statewide issue. It is not
Yes.
Pinellas
Sure.
only. Other jurisdictions.
So just for our citizens, that fee is on what service now currently?
it's the communications fee,
Yeah, it's
specifically for 911. It's on your phone bill.
It's on my landline phone bill and it's on my cell phone.
Yes.
And the disposable phones. There's 3 different
Now
categories.
it is on disposable as
Yes.
well.
So it's interesting because you replace one landline phone, you drop that, but you pick up potentially 4 cell phones in your house. Is it on the one bill or is it on each line?
Let me offer some comment on that. If we were talking about this 10 years ago, there would have been no general fund transfer to cover 911 fees. It would be 100% covered by the E911
Yes.
fund. Today, less than 50% of the cost of the 911 service is covered by that fee. The state fee currently is the second lowest in the nation, and that fee is attributed both to wire lines, prepaid phone lines, and then landlines. And the interesting part of the prepaid phone lines and the wireless lines, the county where those wireless lines are, for instance, the 352 area code or 907 area code, that's the county where those funds go back to, not Pinellas County. And so, for instance, if your area code is a 907 area code, yet you happen to live in Pinellas County, the funds collected by that phone go to the 907 area code.
Interesting. But it's also, I am perplexed a little bit because we have seen other fees, state fees with the landlines decrease, school construction under PICO, there was a fee in there that went to it, and that's decreased over the years. But if there's a fee on each, like, we went from one landline in my house to 4 cell phones, and so you would think there'd be some balance out in there. Obviously, costs change over years, but
There's been there is a formula, a proportioning formula associated with how the fee, once collected, is distributed. Rural counties have one formula, and urban counties, such as Pinellas County, have a different formula. And it's not exclusively about the fee, the rate, the 40 cents per line. Maybe more importantly, it's about what you're allowed to spend it on. Years
Okay.
ago, when the rate was created, it was a system of analog phone lines, and you could only spend it on devices or call takers to answer those telephones. You couldn't spend it on, say, dispatchers. But today, it's morphed to a way, it's hard to tell the difference between the circuitry to handle the phone system versus the circuitry to handle the dispatching system. And so
Okay.
I think the fee itself and then what you're allowed to spend it on are really two. If you looked at the state budget, you would see fairly large volume of reserves in that fund, mostly because of the constraints of what you can spend it on.
all right, so it's the fees, it's the levels, but it's also the eligibility. Okay, all right, I have a little bit of a handle on it now, but yeah, that's certainly a statewide shift that we should have been able to communicate to our legislatures, the need for reform.
It's been on facts list for years. They just haven't been able to make any movement on it, and something we got to continue to push.
Okay. Commissioner Long.
So I clearly, thank you. I clearly heard you say the fee goes back to the county of the cell phone. What about, for example, I have a lot of numbers in my phone that are, for example, an area code 202, which is Manhattan. But, you know, we're a very transient state. People are moving here from all over the country. And somehow or other, it doesn't seem quite right that all those numbers they're receiving services, you know, but they're not even participating. That's not right.
Commissioner, I don't disagree. It's a complex, I'm making it sound simple, but it's a complex issue because it's the issue of not only where the area code originates from, but where the bill is sent to. So for instance, if you have an area code, at one point I lived out in Seattle, but I had a 727 area code. And so it's not only where the phone area code is, it's where the bill for that same phone is sent to. And there's a different formula for commercial and automated phone systems and versus residential phones. Very complicated formula, but your point is right.
So, but is it based on where the bill is sent to or where the phone originated?
I'd have to double check factually. I don't want to tell you wrong. I believe that the commercial phone system is where the bill originates from, and a personal residential one is where the area code, generally where the area code and the towers that service that exist. So if you have a phone that's based out of, say, Hernando County, and the signal for that phone is generally anticipated to hit the cell towers up in Hernando County, that's where the fee would go to.
Well, it's amazing, and we certainly have people who grow up in Pinellas who keep that 727 number as they move around the country, and it's going to be a billing nightmare. I don't know. I mean, as every age goes on.
Well, I mean, I didn't change my number
Right.
because I've had it for 20 years.
Right.
And now, I'm sorry. And now, even when you go to, like when I went to get my grandson the phone, when you go to Metro or whatever, they ask you, do you want a 727 area code or are you okay with another? And then if you say you don't care, they'll give you whatever. They don't always just give you a 727, they'll give you 813 or 404 or
Nobody wants an
305.
813. Nobody wants an 813. That's just silly.
We'll solve that next week.
Well, it's
okay. And
well, it's funny because I tell younger folks. Now I'm going to sound like the old guy, but I remember when I moved 6 blocks and I crossed a magic line. 66th Street was a magic line, and I had to get a whole new number because the shift there. When you could actually tell where someone lived from their prefix. Anyway, I don't know if you thought you were going to be talking about that all this morning, but here we are.
Yeah,
Carry on, please.
I'm sorry. So with emergency medical services, the basic life support ambulances, this was new for FY '22. started that service. The objective was to match the response with the need and to be more efficient. And yes, you know, we can save money with that. But a really important objective of that was to be able to overcome some of the ambulance staffing shortages, because you don't have to have the same level of staffing. So that's been an important thing that was implemented this year. The non-emergency transports continue to present a challenge because now you have to have pre-authorization for transporting something that's not an emergency, and that's just been a lot of extra administrative work. The Safety Emergency Services supports 5 system enhancements, and we'll talk about them more in a few minutes, from the first responders. And if those 5 are approved with the budget, it's about $2 million in FY23. A lot of work has been going on in ambulance billing. They continue to work through their revenue challenges with department initiatives that they've taken on to address the evolving service and billing environment in healthcare. So one of the things that Jim may talk about this more too, I won't talk about it too much, but they had a pilot program where they were able to, shifting the way they were doing the billing was able to generate another $1.2 million for the EMS fund. And so they have a request for proposal to go out and develop a long-term contract for that. And one of their decision points that we'll talk about is one full-time employee to manage that initiative. They've also, you know, the outsourcing that they've been doing over the years has allowed them to be able to reassign the internal staff who are specialists in a lot of this to the things that are really going to be the most effective use of our staff time. So let's see, I'm still on page 2 at the top here. The items, some of the items that are impacting the budget or may impact the budget, depending on where we go with the proposed and what you approve. The budget submission for the first responders, which is, you know, fire departments, reflects a 7.2% increase based on the current level of service. So that is one of the things that is an impact on the budget. Another one, it's been 10 years since we had awarded the medical director contract, and that has come up for the next one. Anticipating that it would go up some, SES put $1 million in the contract, and the only proposal that we got that came back in, and it was $1.5 million. So that's something that we're looking at possibly having to increase. And the No Surprises Act, which I honestly don't know a lot about yet, although I know the basics about people not getting surprised on their medical bills. But that's one of the things that's also going to add to our administrative costs. And then right now, I'm going to skip over the user fees and come back to that after we go through the decision points and budget a little bit more. So right now, I'm going to start on with the decision points at the, let's see, the bottom of page 3. So at the first one, we mentioned it already, is Prime. I don't think I need to talk to you all about that anymore, but that is technically a decision point for the FY23 budget, adding that $877,000 to the budget. A little bit more now on the fire department funding request for the first responders. There were 5. The total is about $2 million. $1 million, one of that is recurring, and a couple of these are one-time capital cost of $850,000. First one's Dunedin Rescue 60, $325,000 recurring and $250,000 non-recurring capital to add one 24/7 position to implement their Rescue 60. They would maintain the engine as a contractor, so it means they're paying for the engine and we're paying for the staffing. EMS is proposing that the increase be effective at mid-year, so the $325,000 for FY23 would become $650,000 recurring in FY24. Largo Medic Unit 41, again, $223 recurring with $100,000 capital. This is to add 2 12-hour-a-day, 7-day shift civilian paramedic positions. So that's, trying to look at the peak time to provide the service, but not have too much available. and being responsible with that for City of Largo. So the, again, that's effective mid-year, so the recurring cost, if approved, going into FY '24 would be about $447,000. North County Rescue, the chiefs in North County had requested 2 additional rescue units to have for their transport reserve on the north side of the county. And Pinellas Truck 28, which I think you all touched on this a little bit yesterday, when you were talking about the CIP, I believe. So that would be $360,000 recurring. Right now, there is partial funding for the 24/7 seat on that rescue unit. And this would take it to full-time. Is that right? Yeah, okay. So the additional is $360,000 going forward, if you approve this. The St. Petersburg Rescue 13, again, this one would, the city would maintain the engine and we would pay for the seat. And that recurring cost, again, $242 to start that at mid-year '23 would go up to $485,000 recurring in FY '24.
And before you go on, Veronica, Commissioners, if you recall last year, we had a little bit of consternation about, this city wants this and this city wants this, and, and so it kind of put it back on us as almost to kind of defend those positions. And, and we got into things where we say you need a seat if you're at 11 to 15, and what happens when somebody gets to 10.5? Do you round up or do you wait until it's in the middle of 11 to 15? And we got into several of these, and you asked that I meet with the city managers and the fire chiefs regarding that. And so we did that following last year's budget, and it really was that the consensus was, and I say consensus because 15 people and 15 different ideas. But the consensus was that it's working well. You have a data-driven focus group. You got a staff that can look and analyze that information, talk through that with the chiefs, and then go out, and Jim does, and meets with each entity, and then makes a recommendation. And that seems to be, we couldn't come up with, kind of refining that more, but I think that better judgment and using the data to help drive that decision is the key. We're doing that this year. I actually think, it worked well. And actually, some of the things that we did not recommend last year are on that list. Because he's also using that with some of the other programs that we've implemented to drive down that growth. And the whole idea, if you recall, is to not go back to the days where the levy was continually maxed out every year and requests for increase. So you had city managers as part of that in addition to fire chiefs. And so that was the outcome of the meeting from last year. We used that same process this year, and these are the recommendations that before you. So,
And we've separated out the capital, because we saw some of those on that list yesterday about some stations that had costs increases that they weren't expecting, kind of things in their normal capital.
There is, and you'll see that with some of the capital, and again, you've got an EMS side to that, you've got a fire side to that, and you have some that have separate levies. You have some that are unincorporated, and some that's a mixed jurisdiction. So,
oh yeah,
there's no silver bullet. It requires analysis and discussion, and coming up with a thoughtful recommendation.
And this may not, I don't know, you may not have the answer to this, but St. Pete has been operating a satellite pilot, I don't know what they're calling it, station in West St. Petersburg. Do you know the status of that? They're going to continue that, or do we know?
Yes, Commissioner, I can answer that question. I believe you're referring to their Engine 2 location on the border of Gulfport and St. Petersburg.
No, this is 66th Street and 33rd Avenue. They basically took a old house and made it a fire station.
Right, so they're
the important reference point.
So that is a funded ALS unit. One of those seats on that fire truck is paid for by the EMS system. But it's St. Petersburg intention to continue to operate in a more permanent location. They're searching for land. I believe they've secured that land. And their intention is to build a more permanent fire station. Call volume is adequate and it's necessary. And I think they intend to continue that unit.
Okay, thank you.
Okay, so going towards the bottom of page 4, I believe. Ambulance billing and financial services touched on this with the point of, at the beginning here. because of the success that they've been having with the way they're focusing their work in the ambulance billing, they see that they can have a strategy to, if they add a position to be able to focus on revenue generation, that we could bring in as much as $1.5 million more in net annual revenue. So that's one of their requests, is to add one full-time position.
And they're, here's an example where you look at the history of their success, and the history of success is that when they make changes like that, they actually bring in the revenue that they project. And so I think Jody and her team do a really good job of finding ways of increasing that revenue.
Okay, and then 9/11 wide area network services would be a $340,000 recurring cost in the general fund. It's a second wide area network with interconnectivity between regional 911, the routing network, and the 5 secondary public safety answer points, the PSAPs. Oh, that's on the top of page 5? Yep. Okay. I have my extra notes, so I get messed up with where my page numbers actually are. So, okay, top of page 5. And then the next one is the video to 911, which would be $150,000 to start, and then $100,000 thereafter. And basically, that's a new technology that lets, if somebody calls in and they want to send video to the 911 call taker, they can. And sometimes it makes a big difference if the call taker can see what's happening. So it's an interesting possibility, and that's one of the requests that Safety Emergency Services has made. Going into the budget summary then, the revenue, again, we talked about the continuing work on increasing the ambulance revenues. Total revenue is $9.6 million, or 6% over the FY22 budget. This is partly coming from the ambulance transport fees, and a good deal of it is from projected growth in the ad valorem tax. This went to press before we got the updated information from the property appraiser. So the information here on the table, where on the first line it has $86.4 million for taxes, actually, because of the increase going up more than we anticipated, that's now going to be about almost $5 million more to $91.3 million. So those numbers will all be updated when we get to the proposed budget document. And then the expenditure budget, I'm on page 6 now. So the total operating budget is increasing by $17 million, or 7.4%. Personnel service costs, no additional positions in this number. That one requested FTE is not included yet. Costs are increasing $1.2 million, about 7%. Part of that is the increases in the health benefit costs. We went down for a year, and now we're coming back up on that. And then the implementation of the career path and ladder, which everyone knows about, and reclassifications, the things that they've been doing with the 911 in particular to work with the staffing issues there. So the operating expenditures going up by $5.6 million, 6.6%. Primary drivers there always are the ambulance contract and the first responder contracts. So it's the other thing is we do have new modules for the existing CAD system in there. And still at 198 FTE over the last 2 or 3 years. That would only go up 1 if that position that's requested gets approved. And I'm going to scroll through the programs because that's something that I know we don't want to take a lot of time up right now. So I'm going down to page, I'm sorry, I'm going to go back. Yeah, back to the user fees. I'm sorry, back to page 2.
Back to page what?
Page 2.
Oh.
Yeah, we'll do the
Middle of the
user
page.
fees, and then Jim's going to take over after that. Okay. So really, the main thing here is, EMS is the primary, user fees. It's the ambulance transports for the most part. And each year, EMS, they try to keep up with the inflation, the consumer price index, and ambulance costs. They do survey, they keep up with the peers in the area for their fees. So these are the fees on page 2 that they're proposing to increase for FY23. And Then on going down into page 3, that gives, I'm sorry, page 2 is the comparison with our peers. Page 3 goes into the actual changes in those fees that would be proposed. And the one thing of significance to point out is because the basic life support ambulance service was added in FY23, now that we have that, we need to have a fee that's geared towards the cost of service for that. So now we have a fee of being proposed of $800, which is between the cost for advanced life support emergency response and basic support non-emergency. So now you've added emergency and we've added a fee to be able to capture that. And I think at this point, I'm going to just go over to Jim, back to page 9.
Thanks, Veronica. I appreciate that. When you manage a department as large as Human Services or Safety and Emergency Services, you have to pick and choose what you want to highlight when you do a presentation like this. So I'll do that. But I do want to acknowledge some folks before I start. There are 4 people that could have easily done this presentation today, just like I could. And those 4 people and the team that they lead in emergency services include my Deputy Director, Dave Hare, who has managed support services remarkably over the last year. Jody Seschler, who normally would be sitting next to me, but Jason here is today. Jody and her team remarkably handles the ambulance billing and financial services. Judy Wysensky-Price and her team of telecommunicators, which just as recently as last night, stress tested the 911 system, make sure that it was going to work during hurricanes. And so Judith is probably resting right now after being up till all hours in the morning. And then finally, Craig Hare, that most of you know, who manages the fire EMS system. So thank you to them and their team. And they can't be here because they're out managing systems. So I wanted to quickly review our accomplishments. And what I've picked are strategic accomplishments that I feel you would probably be most interested in, because there are dozens, if not hundreds, of accomplishments that I could have chosen. And I'm going to pick one from each of my 4 divisions. For support services, this section that Dave Hare manages, I want to highlight the strategic partnerships that we have created, because I think it's important to identify accomplishments not just for this year, but the ones that will make a difference for the next 10 years. And one of those accomplishments is what I'm going to term strategic partnerships. The idea here is to identify things that already exist, capabilities, functions that already exist somewhere in the county, and take best advantage of them. And those are strategic partnerships. Now, there have always been some. Emergency management and safety and emergency services have always had this strategic partnership. And in some cases, sometimes people confuse the 2 departments. But we've developed strategic partnerships in such a way that it really sets us up for best advantage in the future. For example, a strategic partnership that we've developed with Human Services has already led to improvements in outreach programs and improvements in the emergency medical services program. And it shouldn't be minimized how important those partnerships are, because in many cases, they didn't add 1 FTE. As a matter of fact, they reduced the number of FTEs we were able to create. So we have strategic partnerships with administrative services, as they're now taking over some of the maintenance of our radio towers and doing security fencing. We've got strategic partnerships with human resources as we reclassify positions. But really, one of the more important strategic partnerships is the one that we've got with BTS. We recognized the need for fast and very broad talent in technology. And it wasn't something that we could likely replicate. And BTS really had a team of engineers and architectures. And so we entered a service level agreement about a year ago that really capitalized on their strengths in terms of their expertise in technology, and capitalized on our strengths in knowing how emergency systems must work. And that has been a very successful strategic partnership that I think will pay dividends as we go into the future with vendor relationships and system designs and change managements. And in large part, my good friend Dave Hare is responsible for that. I want to highlight second accomplishment is the participation in what I'm going to frame PRIME. And a lot of times folks think of Prime as the software product, the Hexagon CAD system that we're purchasing. But Judith Wasinski Price and the 911 Center over this last year has prepared the 911 Center, anticipating the new way to do business, not only with the CAD system, but everything that's associated with that. For instance, normalizing the MSAG database that the system must have in order to accurately understand the caller's address. Creating network infrastructure redundancies, so the system as it's designed, and doing things like initiating closest unit dispatch from the emergency medical services. We did that about a year ago, and we're just now doing it with the fire services. So when they flip the switch and CAD is turned on about a year and a half from now, closest unit dispatches will be a thing of the past, run card analysis will be a thing of the past, and that doesn't happen by accident, and Judith Wasinski Price and her team is in large part responsible for doing just that. Accomplishments with financial services and Jody and her team, you heard a little bit about it, increasing collection rates from 60 to 65%. We think we can do better. And that's at the same time where other organizations over in Hillsborough County, City of Tampa, have collection rates into 20 or 30%. We've got 60, 65% collection rates. Our ambulance user fee has been designed to cover the use portion of the process, the ambulance ride itself. And in fact, that's done at a time where the ability to collect non-emergency ambulance bills is getting really challenging with the constraints third-party payers put on us, the requirements to have negotiated rates. All of that's been challenging, and Jody and her team, including Jason, has been part of some pilots to increase revenues, and we think we can do more. So I want to identify Jody and her team for those accomplishments. And then finally, Mr. Craig Hare and the fire and EMS system. We were faced with an enormous challenge with the ambulance contract and their ability to put ambulances in the street at the same time where the number of requests for 911 services was growing, and at the same time where hospital bed delays were causing some problems. And so Craig and his team, in full cooperation with the fire service and full cooperation with the ambulance contractor, stepped up to the plate and designed and tweaked the system in such a way that the system today is functioning as designed. And I think that's a strategic accomplishment that leads to things like adding Dunedin Rescue 60, which is a transport-capable unit that can now serve as a surrogate ambulance in times of stress. The other two transport units that we're proposing, again, part of that plan. So those are my accomplishments. There are others, but I wanted to quickly move on to performance metrics and measures. Again, there are literally hundreds of operational performance measures and metrics, but I'm going to focus on just four, which I feel are strategic that you would want to know about, although please ask me if there are others. The first one is the percent of 911 calls answered within 10 seconds. It's a very good measure of the operation of the system. And the way we measure that is from the time the 911 call hits the circuitry to the time the call taker actually picks it up, and it's measured in seconds. We'd like to answer 90% of those calls in 10 seconds or less. And in most cases, we do that, not all cases. And there's reasons for that, not all cases. The reasons include more calls coming into the center. We've got 1.2 million calls that enter our center. And the duration of the calls, when you have a COVID call and people are trying to tell you about their exposure rate, those conversations take time, and the average duration of a call has been extended. In addition, the challenge is with the number of call takers talented and trained to do that has been challenging. So our measures are at 90%. We anticipate hitting those, although there are time periods where we do not. And so that's the ideal measure for that system. Another measure is the response time, and we measure response times at a high, low, and really detailed level, both on the ambulance side and the first responder side. You see that marker of 93%, we'll probably hit that, but you should know some of the detailed measures we do not hit. There are challenges up in the East Lake area, challenges in the Tarpon Springs area. We're very difficult to serve because of bridges to the point where you can't drive a heavy ladder truck over it or something like that. So those measures are there. We do have the detailed measures. We measure on a daily basis, on a fractile basis, and we'll be glad to share them with you if you'd like. And then again, the percentage of ambulance service charges that are collected. We think we can hit 70%. I think we will hit 70%, but it's going to take a Herculean effort and some changes to the way we do business to continue doing that. And then finally, and this is an important strategic measure you're familiar with, and that's the cardiac arrest survival rate. It's trending down, and that's not a good thing, that's a bad thing. It's trending down, it's at 31%. There's reasons for that I won't go into here today, but more importantly, what are you going to do about that? One of the decision packages for video to 911, there are other systems that are using that video signal to look at how CPR is being applied and can make instant corrections real time with a video signal. And so we anticipate a sort of a 10% difference in the quality of CPR instructions provided by the call takers in making that measure improve. And there are other things, but due to time constraints, I won't go over.
What is that rate? What has it been? If it's 31% currently?
It was as high as 37% a number of years ago. It's dropped to 34%, and we anticipate this year it'll be 31%. A lot of components to that, the age of the population, some of the population has been putting off health care. And so it's an ideal measure because the entire system has to work from the person in the patient's condition to bystanders doing CPR to automatic defibrillators and everything in between. We think we can do better, and we will do better.
It's interesting considering the defibrillator devices accessibility more has increased over the last 10 years, and education you would think has continued to at least maintain, if not increase, as far as how to do that, the changes of the CPR standard. So it's an interesting number.
Again, we're not unique. Many other systems, for instance, the system that I had been from previously, Seattle, they've noticed the degradation of their survival rate too. So what causes it is a different question from what's happening.
Commissioner Eggers has a question.
I'm sorry.
Yeah, thank you, Mr. Chair. I was just going to follow up on that line of question. That number, I'm glad you gave some perspective to that number because the number seems really low. I just want to make sure I'm clear. So in 10 folks that call for service because of a heart attack issue, only 31% now are being delivered to the hospital with a pulse. That's what we're saying?
Right. So it's very detailed and exacting in terms of the definition. The definition for a cardiac arrest survivor by the CARES and by Utstein template, as they call it, is somebody that is found in ventricular fibrillation, sort of an EKG pattern that is correctable. Someone who's found in that pattern who is delivered to the hospital with a pulse and is breathing. And so that's the definition. Now, of course, there are others. If you've got someone with traumatic injury, you've got somebody that is at the end of their life that perhaps has cancer and is sort of a hospice. So there's folks that are excluded from that. Folks that are not found in ventricular fibrillation, someone having a heart attack, for instance, that would not be included. So that's specifically people in ventricular fibrillation, a shockable rhythm that is delivered to the hospital with a pulse.
So how are those numbers? They look completely different, but how do they compare to the ALS response times that we have? It looks like we're showing within 7.5 minutes we get there 90% of the times. We have some gaps, you said, in certain areas. Are there correlations between the gaps and even worse numbers on these cardiac patient calls that we need to be aware of? May not generate big numbers of calls, but nonetheless, because of restrictions, or whether they're infrastructure restrictions or unit restrictions, we have a bigger problem that we need to be aware of?
Commissioner, I'm not sure we have the time to go into the detail, but in general, there is a relationship to the arrival of an advanced life support provider and survivability. For every minute that goes on, there's a 10% degradation in survival rate. So if in our system with the 7.5 minute arrival time, it's a little bit misleading in that most of the time, there is a unit that arrives in 4.5, 5 minutes. That is really misleading, but you're correct. You could make the case that an arrival time of 7 or 8 or 10 minutes is a long time. The key component, I think, to the success, and this is documented fairly well in the literature, the key component is the ability to perform quality CPR in the interim. If no one is performing CPR, and this is for the public, I suppose, if no one is performing CPR, the chances even at the 4.5-minute mark of survivability drop dramatically. And so the paramedics can only be successful if there's someone still with a life to save, meaning their brain is being perfused with CPR. So yes, Commissioner, there is a relationship to the time ALS gets there, and we could first, but I don't have any specific. If we had a specific issue, we would have addressed it.
Yeah, I'd be curious as we go forward to certain areas that might otherwise seem okay in terms of call volume, but really have issues of response time because of whatever restriction. And then the other piece of this is, I think, and you alluded to it a couple of times, is how we upgrade the messaging to residents to take CPR classes, and just to understand what role they can play in the general community, but also in their own home, because you don't know when that's going to hit, and to be able to add significantly to the survivability rate would be really important. So anyway, appreciate the response. Thank you.
To conclude, I wanted to move to work plans. And again, I'm going to focus only on 3 of the work plans. There are literally hundreds of work plans, and Lourdes Benedict gets monthly reports on an internal SharePoint presentation of those work plans, each one with a metric and a measure. But the 3 I wanted to highlight here today are managing growth, the regional 911 operations, and the CAD Prime project. And I'll do each of those briefly, but I'll ask if there are issues that you know of, please advise the county administrator so he can direct the department to either create a work plan or refocus some of the efforts that we have to that work plan, because we want to meet the needs of the community at all times. So the work plans that I wanted to highlight, growth management. You've heard me say this before. We thought we'd like to manage the growth of emergency services by no greater than the growth of the population. When I said that 3 years ago, the population was growing at about 1.9%. That is no longer true. I don't know what our population growth rate is now, but it's a lot. Verizon reports there were over 250,000 new cell phone wireless numbers issued in the Tampa Bay area just in this year alone. So if you use that as a surrogate of who is moving here, emergency service is going to grow. And so to manage that growth, to no more than the growth of the population, will be a challenge. Don't read that to think that we're not going to have to add to services. We will, as you see, as the proposed adds this year. But there's a healthy back and forth with each of the fire chiefs and the ambulance contractor on how to best add those services. But we have some things in place. We have recently hired a data analyst that is reestablishing the growth management strategy, which includes a communities of care approach. This is a locations-based approach that looks at locations. Why are you calling us so much? And then, more importantly, what can, if anything, we do about that? And we've looked at, for instance, dramatically high levels of traffic crashes on the Howard Franklin Bridge. Why and what do we do about it are different. So we have a communities of care approach, which is a locations-based approach, a complex case review, which is a sort of an individual person-based approach. People that call us a lot, there's usually complex reasons why that is. And then we have what's new as a crisis syndrome approach. Those are the opioid task force, the COVID, the community-based problems that somebody needs to focus on. And most recently this year, we're looking at gunshots and we're looking at car crashes, particularly pedestrian autos. Again, our strategy is not to create yet another pilot project, but our strategy is to utilize those existing projects that are out there in the community, provide them the data, and see that if we can measure an improvement in managing the growth. We have anticipations of creating a couple of outreach campaigns. I spoke with Barbara Hernandez just last week in our marketing team in re-energizing the Make the Right Call campaign to try to make sure folks call 911 quickly and only when it's appropriately. And then maybe creating alternatives to what a caller might need and utilizing some of those resources. You know, soon there'll be a 988 line for suicides. There'll be other lines that we might take best advantage of. And also creating and testing more effective approaches to response. It's the managing growth. The other work plan item is the regional 911 operations. It sounds simple, but like I said, that has a lot of components to it. How is it funded? It's unreasonable to expect local tax dollars to continue to fund this system, and it's going to get more expensive, not less, as next generation 911 circuitry comes in, normalizing databases, et cetera. So we have an industry, the 911 industry, that's in dramatic change. We've got expectations of that industry. What can you expect? Residents can expect to have someone answer their phone in 10 seconds or less, and once that person picks up that phone, to instantly be able to provide instructions about exactly where you are, what can we do about it. That person has to learn, at least today, 3 different CAD systems to interact with. Hopefully, in the near future, they'll only have to learn 1. And so the Regional 911 Operations Work Plan has dozens of individual components associated to it, which includes the new CAD system, but it includes others as well. We currently are revamping entirely the run card system in conjunction with all of our fire departments because we anticipate it'll be a much different deployment methodology when AVL and the computers start to interact and do that. And then finally, the CAD and Prime project. We've already discussed that, but you shouldn't minimize how important that project is. Don't think of it as just a contract with Hexagon. It's that plus dozens and dozens of, it's a records management system, it's an evidentiary collection system flowing from the time the crime is committed back into the court system and everything in between. So I'll stop there. I apologize for being so long, and I'll entertain
No,
any questions.
this is all important stuff and deserves the time and attention. And I think that I don't think we can shout the Prime project any louder. I think that's, I mean, universally, I talked to so many of our police chiefs and law enforcement out in the community, and this is something that they're all really excited about, not just being the latest toy, but something that's really going to help facilitate service. So I don't think we can talk about that enough. Commissioner Long, did you have a question?
I do. I look on here and I see what appears to be a really large number of vacancies. And yeah, what's the plan? Are we working on, what kind of recruitment efforts are we making?
So we have done a few things, not enough, I acknowledge that. So for example, over the last 6 months, we've consolidated the classifications. Right before, when you were hired, we would offer you a wage rate at a law enforcement telecommunicator, which then you would advance to a public safety technician 1 to a 2. So we've consolidated those so we can offer a higher entry-level wage, which is exactly what they would have gotten once they completed. We've developed some really specific outreach targeting campaigns with marketing and communications. Just recently, we had some paid outreach to New Jersey, to Indiana, to New York, targeting those areas so we could incentivize experienced telecommunicators either at the supervisor level or at the call taker level. We'd like to hire somebody with 1 to 3 years experience. But there are challenges. For instance, I had conversations with 2 people that were from New Jersey saying, hey, why don't you come on down and work and become a call taker to us? And when they investigated the cost of living, what it cost to buy a house, where they would live in here, they said, even with what you can offer me, which would be above base, they said, I can't afford to live in Pinellas County. And so that, you know, those and everything in between. And there are other things that we're doing to incentivize this. We've talked about referral incentives. Our success with people knowing other people and say, hey, come and work in Pinellas County because it's a great place to work has been very successful. So with the cooperation of the county administrator and his team, Rodney Marion specifically, you know, we've talked about hiring incentives and recruitment and retention incentives, and there's more to do. But we recognize we need more people. We have the positions. That takes the form of simplifying the onboarding process. Right now, it's 10 weeks to onboard somebody to teach them how to answer the phone and use all that technology. So we have to simplify that.
Commissioner Seal.
Yes, thank you for a very comprehensive overview for everything.
Microphone, please.
Sorry, I should have recognized that. I couldn't even hear myself. I am concerned about the increase in the ambulance fee. And granted, we're still lower than some of the other areas, but we're also higher than many. And at the last commission meeting, we had the proposal from the EMS management and consultants, and that's a $6.7 million contract for 5 years. And their collection success, according to the agenda, was from 65% to 70%. And granted, we may be doing better than other areas, and you want to add another person, but why isn't this company doing a more comprehensive approach for that kind of money?
Well, the company that you're referring to, EMSMC, they do a very comprehensive approach, but I think the way to think of it in this world, ambulance billing and medical billing in general, is a very complicated subject. But that company has been engaged to rapidly send out a bill. And they send out 90% of our bills. They do it quickly because the timing is everything. That allows the department to take the bills that have already been sent out and sent back for denial for all kinds of reasons to look into why is that. And that's what Jody and her team do best. Because there are subtlety reasons. For instance, if you send an ambulance bill to Blue Cross Blue Shield and it actually is a traffic crash, you'll get a denial. Say, no, this is not our problem. It's a car accident. It's their problem. And so rather than engaging the contractor to do that backroom work, our team does that. Our team still retains 10% of the original billing just so they stay practiced on that. And so there's reasons for that, as the contractor is very proficient at what they do and does well. That's why we have such high levels of collections. But I think more importantly, speaking to the rate itself, when you send an ambulance bill, depending on who you send it to, in some cases, it doesn't matter what the ambulance fee is. They're only going to pay a certain amount. Medicare, they have a allowable rate, and you could send them a $10,000 bill, and it's tough cookies. They're only going to pay $485. If you send a bill to a Medicaid patient, they're only going to pay $195, even though it costs the system nearly $400 to do that service. Medicaid only pays $195 of that. And so we have a proportioning of who pays and how they pay. And so the increase to the retail rate to keep it normal is necessary, not only so we can have the third-party payers pay what they're supposed to, for instance, the car crash. They will allow 200 of the Medicare allowable rate to pay. And we can't charge that because our rate is lower than their amount they would pay. And so raising the rate impacts folks in certain and different ways. Folks that can afford an ambulance bill have the membership subscription program to help offset that. So we've tried to strike a balance. We've got a couple of new ideas that we'll propose next year. But the increase to the retail rate, again, that rate is designed to cover the ambulance service fee. We know the ambulance fee is going up and probably will continue to go up. And to match that, the retail rate has to go up as well.
Just kind of an observation, it's not really in your area, but it occurred to me is on the human services, we do an $11 million Medicaid match. Instead of going after school nurse funding, we should be going to the state and saying, look at this kind of match that we're doing. That's a lot of money. So it kind of relates back to the ambulances, because this is ridiculous if they're not paying but less than half of what our actual costs are. So again, maybe putting this on the issues for state monies. I mean.
So there is a program, because we're a government entity, there's a program called PEMT. You'll see it as a line item in there. And that's a Medicaid match type program for reimbursement streams that don't nearly cover the cost. PEMT is sort of an alternative way, and it's a match program just like the one you're referencing that we participate in.
So we're putting money in that for a match?
We put in money for that, and then we're able to back bill and get reimbursed from the federal government with that match.
Okay. All right. You always learn something new. All right, thank you very much. I really appreciate what all of you all do. Oh, wait, one final question, which was, for transports, how many fire stations are now in the transport business?
I answer that all of them are in the transport business. This is a singular system. It's not a fire transport system or a Sunstar transport system. 100% of our fire stations are in the transport business, but their primary mission isn't transport. But occasionally, their primary mission becomes transport. I'll use Station 35 in Pinellas Park as an example. If they have a car crash and the most appropriate thing for the patient is to put them in the back of Rescue 35 and take them to Bayfront, they do that. And so they're all in the business, and then none of them are in the business. The plan calls for strategically putting the transport-capable vehicle throughout the county. So in cases of system overload, lots of calls coming in, or ambulances shortages, Sunstar can't put enough units on the street, we've got that backstop, and they could cover as much as 10% of the call volume just with the existing metal that we have right now. So they all are, and then at the same time, none of them are.
So which cities or which entities are we funding at the present time for transport? It sounds like we're going to go to Dunedin.
Well, the thing we fund them for is the vehicle and then the positions on the vehicle. And off the top of my head, I'd have difficulty naming them all, but certainly the larger departments, Clearwater, Safety, now Dunedin, they have fully funded vehicles and positions on those vehicles, which are known as rescues. Palm Harbor, for instance, 2 years ago, got a fully funded Rescue 65. And so if you looked at their bay, the vehicle that looks like an ambulance, known as a rescue, is fully funded by the EMS system. There are some variations to that. If you looked at Oldsmar, for instance, they've got a vehicle in Safety Harbor. They have a vehicle, but it's typically not in service 24/7, but it could be put in service if push came to shove and they needed that. So we've got, Dunedin will be the new one that has a transport-capable vehicle, Largo, Pinellas Park, Layleman, down in Treasure Island. So there are strategically placed vehicles, not just for the transport reason, more importantly, because they're so busy. When you get to a certain point, typically that's more than 15 calls a day, the tasks for that vehicle are so much that they can't have a fire suppression role. So that's kind of the strategy of placing them.
Okay, so sort of where I'm going with this is we can't charge for those transports.
No, we do.
We do?
We absolutely do, yeah.
Okay.
The only
What do we
difference.
charge? Do we charge the same fee as an ambulance?
Right, so the fee structure that you see is much like any other fee structure. It doesn't matter actually who performs the service. The citizen getting the transport will get a bill. The only difference to the system is that we don't reimburse the ambulance contractor for that transport. Typically, we reimburse the ambulance contractor about $250 for each time they put somebody in the back of the ambulance. And in the case where the fire service does that, the ambulance contractor does not get reimbursed.
Okay. Thank you very much.
Thank you. Commissioner Flowers.
Thank you. I'm not sure if this is, and if this is something we need to talk about another time, let me know. But I spoke with two representatives from, I believe it was Pasadena, regarding the share, excuse me, regarding their contractual services versus the RFP that I guess the city of St. Pete applied for and won the bid or won the contract, if you will, 76,000, 74,000 or whatever for a portion of the services that they're saying they also provide. They meaning Pasadena provides. Is that something that is included in all of this budget information that we're talking about potentially approving? And if so, can you expound on that? If it's something separate and apart, then I can chat with you another day about that. I don't want to take up your time now.
Yeah, I would recommend we chat offline because it really spans the issue of how taxes are applied, how services are provided. But in a general way, in dependent fire districts, meaning a city that has unincorporated areas within a dependent fire district, Seminole's got a dependent district, South Pasadena. In general, for dependent fire districts, the fire district itself provides the service to the unincorporated areas by contract that we have with the county. South Pasadena is unique in that St. Petersburg actually provides that service, not South Pasadena. And so we're looking at that and we're working on, is that the right thing to do? And if not, what should we do about it? And so I can brief you more offline if you'd like.
Okay, that's fine. That's why I said I wasn't sure, so I just wanted to give the option. And I think I'll ask you the other one because it's some information I want you to provide me with. So I'll send you an email. Thank you.
Further questions? This is just a curiosity, and so if you don't have an answer, I completely understand. But I follow Ion TB online. You're probably familiar. He's tracks newsworthy happenings. But it seems, I don't know if it's anecdotal or just if there's a statistic, more car flips at accidents, and whether that's the speed of the accident or something else is going on, but there seems to be more vehicle turnovers than just straight crashes. And I don't know if you have any stats to back that up, or if that's just what I'm seeing online.
I don't have the stats here today, but you're correct in a general way. The vehicle crash, the severe vehicle crash where it flips or it hits head-on, is increasing. Now, vehicle crashes in general are increasing, so are serious crashes. And those crashes seem to be in specific locations that we know about. And there's reasons for that. So I don't know why a vehicle, you would think quite the opposite, the design of the vehicle would make it less likely to flip. But part of that, and I don't have statistics, it's just that, I've lived long enough to realize that it is likely inexperienced drivers and distracted drivers and folks that generally don't appreciate just how quickly you can have a mechanical failure with a vehicle or an unexpected thing could occur. And we see that. I think there's a relationship to the crash, to the experience of the driver.
Further questions? Thank you very much. We really appreciate your time today. All right, Mr. Administrator, we're going to, on the motion by the Vice Chair, we're going to take our lunch break. 12:30. Come back at 12:30, please. We're in recess.
we feel pretty good about meeting the OMB target. And this year, that is not true. We're going to be a little bit above that target. I feel very confident that the budget that we've put forward is neither excessive nor insufficient in order for me to carry out the duties and responsibilities of the office. But there are some things that drove the budget a little higher than normal this year. And the first thing would be salaries. Salaries are going to be plugged in a bit higher this year than in past. I think we're all finding it more challenging to staff, and the cost for staff has gone up a bit. But the real issues in terms of increasing the budget were in operating expenses, where we have some implementation costs and some renovation costs at the Mid-County office. Bad news is it's more money. The good news is that those implementation costs will hit this year, and then in following years will be subscription costs, which will be much lower. So, and some of the things we're working on are a new HRMS system, the financial accounting system, some work with content management, and Qflow upgrades to help us with our getting the folks, customers in the door, upgrades to the appointment system to help facilitate that and make it a little easier for us to serve our folks. The HRMS system is it's really a big deal to us. This is going to give us a lot of data and make it easier for us to track employee performance, skill sets, and allow us to better use best practices and skills to better serve the public more efficiently. That's the long and short of it for me. Is there anything that I can answer for you?
Commissioners, questions?
Just as a reminder for commissioners, so the statute drives the fees set, which is the revenue collection, and that's the statutory process for establishing the budget for his office, and it is approved by the Department of Revenue prior to submittal to the commission.
That's true. But as always, we try, and it is my goal to work as closely with the board and the county to produce a budget that is in keeping with good stewardship of public funds.
Commissioner Long has a question.
Actually, I have a couple, if you don't mind.
Not at all.
So when you talked about your challenges, salaries were big. And I'm curious about what your plans are for your employees in terms of helping them meet the challenges of everyday living.
Well, this past summer, we made some increases across the board for staff, and that did have an impact then on our base salary going forward into this coming year. We took a look at data. We were really behind the curve on our folks being anywhere near the midpoint. So we felt like we had some room to work within that, move them a little closer to the midpoint, although I will say at this point, we're still about 80% of our folks not at midpoint yet. So I think we've got some work to do there. And we're looking at this budget has built in higher than a 3% increase.
Good.
So 5%, and I think there's some other things that that we're taking a look at, maybe some retention bonuses and things that just aren't settled yet. So I don't want to suggest.
We're having a discussion tomorrow morning with all the constitutional officers and appointing authorities, and I would hope that we can take a consistent approach as to how we attract and retain and compensate our employees.
And I know you're in the middle of doing all that, Barry. My concern is it troubles me to hear Carlos say his people are not even at the midpoint. I mean, it doesn't say a lot about how you retain good people when, you know, they can easily leave you and go elsewhere.
So we're retooling and getting ready to re-implement career tracks that I think will help us with that. As far as the moves we made this summer made a tremendous impact on morale and helped people out about it.
I bet.
When I came into the office today, I had thank you cards, which were I don't get thank you cards real often, so that was kind of nice. But just to give you an illustration of how well that was met and the increase in overall morale, we, a couple of weeks ago, did a job fair at both our Mid-County and South County offices. And our employees really spread the word on that. Within hours of us posting on social media, we had 3,000 views of that job fair posting. And we were able on the first day to hire 15 new people, the second day, 7. After this meeting, I'm going down to South County to meet with the 15 new hires at South County for new hire orientation. Frankly, I'm just surprised that they all showed up. But
Don't say that, because you still gotta get there.
oh, well, there's still some. You're right, Commissioner. There's still some things to get through, but it really speaks to. I think my folks feel like they are being heard and that we're doing our best to take care of them. But I think there's work to do, Commissioner. I do.
Good. Well, we look forward to being part of helping you do that. Secondly, you mentioned operating, and I'm curious about what that number turned out to be, if you have it.
A 1.7 million combined increased operating expenses, and that's, we're building the platform with a PS and MC virtual desktop infrastructure. We're looking at really changing the way the call center operates. We're looking at setting the stage to be able to implement some artificial intelligent front end on the call center. And so that's one of the moves. The HRMS system, our HR system and accounting system, those are in there. And some things with content and contract management that will give us some data that we need to make sure that we're utilizing skill sets and using best practices where we've got folks that are maybe really superstars in this area. How do we take that to another office? And this will facilitate a cleaner and better use of the data to do that. There's also the Mid-County build-out, the renovation down at Mid-County, and that'll be a single-year expense. This is mostly about implementation expenses, which are always a little bit more. Next year, that should slide back to subscription rates for those technologies, and we'll see a nice sizable drop.
Good. It's nice to see you, so thank you for being here.
Good to see you all as well.
Further questions?
I know all of us are worried about affordable housing and the cost of living for our staff, and it's important. It is important to be there and for them to know that we're there for them. I appreciate that kind words, Mr. Flowers.
Thank you very much. Always good to see you, sir.
Thank you.
All right, item number 7, general government.
Thanks.
So,
Mr. Zoss, did you want to comment on this?
No comment.
Thank you.
Thanks, Charles.
thank you, Mr. Chair, and thank you, Mr. Zoss. Cecilia McCorkle will be presenting today on general government and the general fund.
Good afternoon. So just to start overall with the general fund and the status of this at the time of publication of these reports, as you know, things continually move. So overall, the general fund budget is decreasing by $15.2 million, or 1.6% from FY22. The beginning fund balance, and we're just right here at the top of page 1, the beginning fund balance is decreasing by $74.3 million for FY23, and this is because we strategically spent down some of our recurring fund balance that we had rolling over from lapse in prior years. A big portion of that was $62.7 million that was transferred from the general fund to the capital improvement fund, and this was for future facilities. We also sent over $4.6 million to Transportation Trust as a non-recurring item for FY22, and this was to address those backlogs and the sidewalks that you heard about yesterday in the Public Works presentation. We also had additional appropriations that you saw come forward this year, or one for the sheriff's helicopter, which was an approved decision package for 22. We just waited to put the appropriation into the budget pending the delivery and the timeline on that. So that wasn't unexpected when it came up this year. Additionally, we rolled back the millage from 5.2755 to 5.1302. So what that helped us do was to lessen the fund balance that we're continuing to accrue over the years, so that our revenue is a little bit less in 22 than it would have been if we had not done that. Moving on to walking you through a little bit of the chart below. If you exclude the beginning fund balance, our revenue is actually increasing by $58.6 million, or 8.2%. And this is almost wholly due to our ad valorem increase based on that 12.1% property taxable value increase that we saw at the beginning of June.
And I should just say, this is for building a budget. This is not what we will actually recommend.
Yes, thank you. Thank you. And for that purpose, this is using the current millage rate of 5.1302 to make those that budget request for 23 at this point in time. The values may change on July 1st when we get the next round of values, so there could be adjustments there as well. Let's see. Moving down a little bit, you'll see there is a decrease in intergovernmental revenue. That category actually has our revenue sharing and our half-cent sales tax is buried in there. Those are actually increasing by 3.5%, as you probably heard about in the forecast last week. But it also has mostly our grants that we receive into the general fund for the departments in the general fund. So this is somewhat cyclical, but it probably will increase a good bit by the time we adopt the budget as we start to incorporate those new grants awards that we'll see coming towards the end of the year that will be effective next fiscal year. In prior year, you'll see just wanted to make sure you were aware, you'll see a huge jump in prior years in that category in 20 and 21. That's related to the CARES Act and the emergency rental program, so that's why they were such large amounts in the prior years. We're starting to level out again since those have been spent down or are in the process of being completed. And then finally, I wanted to draw your attention to the other miscellaneous revenues. That's increasing by $2 million. And the driver of that is our full cost allocation plan for the general fund, which reimburses the general fund from other county departments for centralized services that we have in the general fund, such as OMB, the county attorney, our facilities within the Department of Administrative Services, as they pay utilities and lease payments for many of the county buildings. So through the cost plan, the general fund recoups some of those costs that we spend out. Moving on to page 2. We have our expenditures on this page, and the table at the bottom will be what I'm discussing the numbers as I'm walking through. So before I talk about the expenditures specifically, I want to note that this does not include any pay adjustments above that 3%, as we were just talking about. Those conversations are still occurring. It does not include any decision package recommendations. And also House Bill 5007, which increased the county-funded contribution for employees for the FRS and the investment plan. That has not yet been incorporated, but that's about a $565,000 increase that we'll see in the benefits. So for personal services overall, from 22 to 23, we're seeing about a 3.3% increase, and that aligns well with our 3% pay adjustment that I just mentioned. And we also have incorporated some career ladders and career paths, as well as some recommended reclassifications of positions throughout departments, and that was based on feedback from HR and reviewing several positions with the county. Operating expenditures are increasing less than 1%, and is mostly due to adjustments to lease costs, the new lease at the South County Service Center, and radio tower facility maintenance. In grants and aids, you'll see a huge decrease there, about $29.9 million, and that's for the Emergency Rental Assistance Program. That's where that's accounted for in the current year. as well as you'll see the expenditures and the estimate in the current year. But the program is expected, phase 2, to wrap up this year, so you will see that drop into next year. We had about $30 million, 30.8 to be exact, for the phase 1 and phase 2 built in 22. Our transfers to other funds are decreasing significantly, and that's because of what I mentioned earlier with the transfer to the CIP, the $62.7 million, and that non-recurring sidewalks funding from for 22 for addressing the backlog. There is an increase, as you heard earlier, for the support, the general fund subsidy for the emergency 911 that is coming out of the transfers there. For FY23, we're looking at a $4.5 million subsidy, and that's a $1.6 million increase from the current year. And then our transfer to constitutional officers is $14.3 million. Just a reminder, and you heard briefly with the tax collector, that we do provide a target to our constitutional officers, and we do try to work with them to make sure we're giving them the right target. We start out with our forecast assumptions, but we address any issues through conversations with the county administrator and the constitutional officers to make sure we're being fair in how we're calculating that. But again, they are the only, the constitutional officers are the only departments, agencies, receiving any targets at this time. So that's why you see more of an increase there than you would in the other departments. And then our reserve levels are currently at 28.4%, which is above our 15%. We did calculate 3 months of cash flow based on the conversation that we had during the general fund discussion for the forecast. And 3 months of cash flow would be approximately $182 million. It would bring that actually up to 23.6%, would equal that, would be the reserve level at that time. Continuing on to page 3, the general government. And this is just the general government rolled up cost center within the general fund, so it's much smaller than what you see. Typically, it would have the transfers and the reserves within this, but since we just discussed those, I backed it out so we could just look at what was new and unique to that. So personal services is a little confusing when you look at this table here at the top of page 3. We do not budget staff or salaries within general government. What you see in 19, 20, and 21 is that's where when we have a disaster or an emergency event, that's where we cost our any expenditures to. So when we have staff working on an emergency event, they will post their time cards to the general government, and this helps us pull those dollars together for cost recovery from FEMA or CARES in prior years. So that's why you'll see actuals, but we do not budget for that. What you do see in the personal services is the county's unemployment costs are located there. Operating expenditures are increasing by 0.3%. There's a lot of movement there, and I've described some of it on the document here. Just a reinstatement of basically realigning the auditing and accounting to where it should have been. I over budgeted a little bit last year based on what looked like a trend, but have equalized it for 23. And also I want to note that the BTS cost allocation for almost all general fund departments, the BTS cost allocation is paid from general government. So what you see here is for the general fund overall. That did decrease close to $600,000 for 23, and that's really due to realigning some of the city works costs better with the stakeholders. So instead of the general fund, it got spread across some of the other funds. There is, what I didn't note on here, but something to know is there is an increase which is driving the operating expense up is for our risk allocation. We had one large claim that carried over from last year that wasn't allocated out through the risk allocation that we are paying for from the general government cost center in 23. So that's a one-time claim cost, which will actually reduce down in 24. And grants and aids, the increase that you see there is for tax increment financing districts. And, you know, that's growing along with our other taxable values. So that increase you see there is in line with everything we received on June 1st. So those also may be adjusted on July 1st. And just as a reminder, your MSTU Special Projects Fund is budgeted within the general government. We continue the allocation of $220,000 a year for the special projects. Right now, the budget we have built in for FY '23 is $768,590. That includes rolling balances from prior years and the 220. That totals that.
And Commissioners, if I could just, I'm going to refer back, so Cecilia mentioned we talked about that you have a 15% reserve, but you also need a cash flow. And so that cash flow would increase that. But I think we really should look at that because, we got some kind of big decisions to make as we implement our space plan and we decide whether we're going to invest, in our current buildings or build new or go into another building and rehab, which are some of those options that we have. But however we do that, we may make a choice on whether we keep things in reserve or whether we put money down or combination of those depending upon if we sell land or whatever. And so there's some really big chunks there that I think can really be looked at all together and make better decisions, at that time when we're prepared to see all of the different scenarios under that. But I do think that 15%, that 3-month cash flow is important because it's not just a reserve, but you've got to have that to react.
Right.
If something, it takes us 3 months to figure out what's going on, before we react to a change in circumstance. So I think we've got it. We've kind of outlined it. You won't see the reserve levels that you're seeing out for '23 because we'll talk about that when I do my projected budget. That'll be down somewhat, and then we can kind of then make some decisions from that. But I really think that it's important. You've done amazing over the years to build that cash reserve, and we don't spend ongoing cost with reserves. It goes to one time because otherwise, if you ever go down that, you'll never get it back. And so over the years, and I wasn't here, you've done a great job with that. Just keeping that and then looking at as a whole with this once in a lifetime or generational decision regarding our facilities and where we're going to go with that gives you a lot of options. And I think we can make those decisions at that time.
Commissioner Seal.
So my little, my parting words are be careful because it took us a long time to build that up. And we did it when there were good years and we did it before the Great Recession. And if we get another good recession, we may need that reserve. So I would be very cautious.
I think we all feel the same way.
'Cause I think we used to only have 2% when I started here. So it was very low.
What is that, like 2 days of operating?
It was one of the things that I recognized when I went through our first budgets was we didn't have that level of reserves. And it was like,
Or even when we have a major storm or catastrophe.
and we need cash. And we did always pay as we go. That's always been the philosophy and low borrowing. But as far as having, a set aside reserve, it wasn't at the level it is now.
And you make
I'm
a
very
really
proud
good,
of that.
you make a really good point. But because during Irma, we in essence fronted all that money, and think about how many years it took to get that money back from the federal government.
Absolutely. Commissioner Gerard.
Well, I just wondered about it. Maybe I didn't quite get what you're saying about making those decisions about space and
So-
tying that to the reserve. That's going to take a while, isn't it?
Well, I hopefully, with CBRE's work, so for instance, we've talked about it, if we relocate and let's just say we build a new building. Okay, there's a lot of options on that, but let's just say you build a new building. Well, you've got value of land here, okay? So we need to put it into a pro forma. I'd like to be able to tell you, okay, if we build a new building, we're gonna sell this land, that comes off the top and here, and then you got a lower operating cost because you're gonna have new facilities. Versus, it's gonna take us X to invest in the current facilities to upgrade that over the next 10 years, 20 years, or whatever that you would be spending, so you can make a business decision. I'd like for them to package that for you. Now, let's say we decide and you decide to go to a new facility. Well, then we have the option of how do we pay for that? You know, and that ties into Penny. You had originally had some money in Penny, but you could choose to go ahead and do it. You could wait till the new Penny and take it off the top, or you could borrow, you know, and use partly cash above a certain threshold of your reserves to help pay for that, and borrow for the remaining piece. Or, you know, so you've got some options there, and I think looking at those at that time would give you some choices, you know. That's really what I was referring to. Because I think, so for instance, if you have cash flows, we fully fund our reserves, and then we say, okay, it makes sense to take 30, 40, 50 million above that, and you pay that off. Well, I certainly would try not to go to penny money, even though we did project using penny money for this, because we've had a hard time balancing and meeting all of the community goals. So we don't want to take anything off of that. So that's some of the stuff we've looked at. Even just, you know, what, a year and a half ago, we were looking at a 6% cut in penny and everything changed. And so, you know, now that's the reason I'm trying to stay away from using penny for that. And so we'd have to look at that time.
Further questions? Commissioner Eggers, I see you're back. You have anything?
No, I just got back, sorry.
No worries.
Nothing right now.
Thank you.
That's all we have.
That's all we have? All
That's
just
it for
staring.
today. We do have a full day tomorrow. I can't remember who's up.
Supervisor elections.
Tomorrow, we have 4 constitutional officers and your budget, the BCC's budget.
All right. Thank you for another good day. Mr. Zoss, any final words?
It was my pleasure being here. Thank you.
Thank you. All right. We're adjourned. See you tomorrow morning. Thank you, everybody.